So see here, we have got a different organ, isn't it? And viscera are there, isn't it? So if this viscera or this vital part, they are exposed, and if they are damaged by the external force, okay, so death or disability may occur there. Okay, so the intention of this body cavity is to do the protection of this viscera and the organ. Okay, so why? What is the importance for the protection? Protection of the organs and the viscera of the body. So main intention, that is for the protection. So it forms the base for the viscera. That means in that cavity only the organ and the viscera will lie there. Okay, so that forms the base for the organs or viscera. So that means the organ and viscera lies there. So see here, see beside that, see if you see the thoracic cavity. So this is thoracic cavity. So individual cavity I will explain. Now see here. So if you see the thoracic cavity, see the wall of thoracic cavity, you will find the musculoskeletal element. So both bones will be there and muscles will be there. So see here in the thoracic cavity, there is the ribs are there that forms the boundary, and in between the ribs there is a space that is filled up by the muscles, that is the intercostal muscles. Okay, so see these muscles, that intercostal muscles, they are the muscles of respiration. Now see the wall of some cavities, okay, they do some specific function. Now in case of thoracic cavity, see the wall of thoracic cavity, they help in respiration. Okay, so the movement of the muscles in the thoracic wall, they help in the respiration also. So protection is there, but see this thoracic cavity, they protect the heart and lungs, that is okay, but it also helps in the respiration also. Okay, if you see the thoracic cavity, so next point you can write here the function of body cavity. So wall of the thoracic cavity help in respiratory movement. Okay, similarly see, so see here in the thoracic wall, the muscles are there, so the contraction, the movement of that muscles, they help in the elevation of your chest. Okay, see while you are taking breath inside your chest wall, it will come forward and upward. Just you try and you can feel that. Okay, when you are taking breath inside your chest wall, it will come forward and upward. So that movement is by the intercostal muscles only. So this movement help in taking breathing in. Okay, so while taking breath out, what will happen? Your chest wall or thoracic wall, it will go downward and backward. So that will decrease the space in the thoracic cavity, then the breath is thrown out. Okay, so that's got some specific function also. So if you see the abdominal cavity now, so the abdominal cavity, mostly muscles are there. So individual cavity we will read, but first general I am giving the introduction here. Okay, so see in the abdominal cavity, mostly the wall, the anterior wall is formed by the muscles, or lateral wall is also formed mostly by the muscles. Only you will see the bone in the posterior midline. Okay, you can see in this picture here, see here is the bone in the posterior midline. But the anterior wall you will find the muscles, and the lateral also you will find the muscles. So most of the abdominal wall, they are muscular. Okay, only few places you will find the muscles and bone both. Okay, just you remember this thing. Now see here the movement in the muscles of the abdominal wall, they will help in the expelling the fecal matter, and also helps in the expelling the urine, and also help in the expelling the fetus in case of movement. Okay, so the movement in the wall. So if the muscles of the abdominal wall contract, then what will happen? So intra-abdominal pressure will increase. So while you are in toilet, so while you are throwing the stool, so there is the help of abdominal wall also. So muscles will contract, so it will compress the abdominal cavity, the space will reduce, so there is an increase in the intra-abdominal pressure, then it will be easy to pass the stool, pass the urine. Okay, in case of lady, it is helpful in passing the fetus. So during delivery also it is helpful. So the wall of the abdominal cavity help, just you can copy from this writing, okay, help in passing stool, urine and during giving birth to baby. During delivery of the baby, okay. So urination, so it is help urination, that is micturition, terminology are there, and passing stool, that is the defecation, okay. Just you write here now, passing the stool, passing the urine and delivery of the baby by increasing intra. Okay, up to here, are you getting? Now see, this is not only the function of the body cavity. Now see here, you will find the other minor body cavities also. So minor body cavities, see, you have got a nasal cavity, isn't it? So this is they are the minor cavities. Still they are the body cavities present in the skull. So this nasal cavity, see, the nasal cavity, so this nasal cavity, so it helps in the respiration, okay. Okay, now see, along with the respiration, see, it also helps in the articulation of the voice. Okay, see, if say your vocal cord, they are producing the voice, okay, and the word, initially it will only phonate, phonation is done by the vocal cord, and this phonated sound is converted into word by the articulation of the different structure. So this articulation is done by the tongue, lips, nasal cavity also. So the nasal cavity, it has got a role in the articulation also. Articulation of, see, just you remember that the larynx is the voice box, isn't it? From here sound will produce, the sound produced by the vocal cord here, it will not produce the word, okay, just it will produce the sound, but that sound that is not understood by other, okay. So first it will produce the sound while throwing the ear outside, so that voice is converted into the meaningful word by the articulation of the different structures, okay. So these different structures, one of them, that is the nasal cavity also, okay. So articulation. So similarly other are also there. See, if you see the middle ear cavity, so you will see, find the 3 ear ossicles, okay. They help in the conduction of the sound wave also, okay. They are the minor cavities, so it also helps in the conduction of the sound wave also. Just you remember this thing. So major function, that is the protection of the viscera, and it provides the base for the viscera, okay, at which or on which the viscera lies there, okay. Then the wall of the thoracic cavity helps in the respiration, so breathing out, breathing in, okay. So abdominal cavity, it also helps in the defecation. So many cavities, so different cavities, they have got a different functions. Thus they are the basic functions, okay. Thus you remember this thing. Now we'll go for the individual body cavity now. So this is about the introduction of the body cavities and role of the body cavities in the body. So next is the body cavities present in the body. Now see, there are many body cavities present in the body, and broadly we can classify this body cavity in under 2 categories, okay. Body cavity we can divide into 2 headings, we can divide into 2. So one is the dorsal body cavity, division or classification of body cavity, division of body cavity. So there are basically two division are there. So the 2 division are there. So out of that, the first one, that is dorsal body cavity. Dorsal body cavity. And the next one, that is the ventral body. So all the body cavity we can classify under 2 headings, okay. One is the dorsal body cavities, and next one is the ventral body cavities, okay. So see here, so name only suggests that. So dorsal body cavities means they lies along the dorsal aspect of the body. So dorsal means on the back side, isn't it? So terminology we have already studied dorsal and ventral. Ventral means towards the front and dorsal means towards the back. So all the body cavities which lies along the dorsal aspect of your body or dorsal aspect of your trunk, they are the dorsal body cavities. Okay, and the ventral body cavities which lies along the front part of your body, they are the ventral body cavities. Okay, just we have classified all the body cavities into two. So the body cavities may be present on the dorsal aspect, so they are categorized or they are kept under the heading dorsal body cavities, and which are present in front part, that is the ventral. So ventral means front, towards the front, dorsal means towards the back. Okay, so they are the two categories of the body cavities, so dorsal and the ventral. Now what are the dorsal body cavities? Now see here, we have got the two dorsal body cavities. The first one is, just I will write A and B. Okay, A, that is the cranial cavity, and the next one, that is the vertebral cavity. Okay, now I will write B and B number for that. Okay, that is the vertebral cavity. Okay, up to here, are you understanding? Am I audible?
Yes, sir.
Yes, sir.
Any confusion up to here?
No, sir.
Okay, so the dorsal body cavities, so cranial cavity and the vertebral cavity. Now see in the diagram here, first diagram here. Now can you see here the cavity inside the skull here? So this is the cranial cavity. Okay, individually I will explain this also. Now just you see the name here. So this is the cranial cavity. So this is the larger cavity or largest cavity present on your skull. Okay, so this is the cranial cavity. And next cavity, you see, that continue with the cranial cavity through the foramen magnum. So this cavity, you can see here this reddish color line here, tubular line here. So this is the vertebral cavity. So they lies posteriorly. So they are the two dorsal body cavity. Are you getting? So the name of two dorsal cavity, they are the cranial cavity and the vertebral cavity. So individual cavity I will explain. Okay, just you remember the name now. So this is the two dorsal body cavity. Now the ventral body cavity, you can see here in the anterior aspect. See here, this is the ventral body cavity. Okay, so again, so you can classify this ventral body cavity under two heading also, one heading also, two heading also, three heading also. Okay, no problem for that. I will tell how to three and how to. Okay, now for first one, so that the ventral body cavity, the first one, that is the thoracic cavity. Thoracic cavity. Okay, see, you can see this yellow, see purple color here. So this is the thoracic cavity. Okay, here, see in the next picture you can see here. See this whole space. Okay, including this orange color, this greenish blue color and purple color. This whole thing. Okay, this is the thoracic cavity. Again, it has got a subdivision. I will tell later. So this whole structure, this is the thoracic cavity only. So next component of the ventral body cavity, that is the abdominal cavity or abdominopelvic cavity. If you write the abdominal cavity, then next will be pelvic cavity. If you write the abdominopelvic, means no need to write for the next. Okay, so this abdominopelvic cavity means there are two are there. So abdominal plus so see here, so abdominopelvic cavity. So this pinkish color and this greenish color together, that is the abdominopelvic cavity. So they are actually these two cavity, they are continuous with each other. So there is no boundary. Okay, there is no like partition. There is no wall between these. So we are writing here abdominopelvic cavity. Okay, so they are continuous with each other. There is no wall between the two cavities. So abdominopelvic cavity. Again, it has got a subdivision, abdominal and pelvic cavity. This thing also I will explain individually. Up to here, okay for you? Now you can see in the picture here. So they are the dorsal group of body cavities, these two. So cranial cavity and the vertebral cavity or vertebral canal, next name. Okay. So now see, these are the cavity, they lies on the anterior aspect. So they are the body cavity in the anterior aspect, thoracic cavity and abdominopelvic cavity. If you want to break abdominal cavity and pelvic cavity, okay. If you want to combine, that is the abdominopelvic cavity. I am combining because they does not have got a partition between, or they does not have got a boundary. There is no partition. Okay, there is no wall between these two. So they are communicating with each other freely. So I am writing only two. So abdominopelvic cavity. Okay. So we'll go further now. Individual cavity. Okay. Up to here, okay. Then next we will go for the cranial cavity. Then individual cavity we'll see. Now see here the first dorsal cavity in the body. So the major dorsal cavity, that is first is the cranial cavity. Now you know the skull, isn't it? So this bone of the skull, head, bone of the head, isn't it? So this skull bone, it has got a two division of the bone. So facial bone and the cranial bone. Okay. So here, so the skull. If you see the skull, that is the bone of head. This here you will find the bony structure, that is the bone of the head, that is the skull. Okay, bone of the head. So if you see the bone of the head, you can divide this into two headings, that is the cranial and facial bone and cranial bone. Now see here, this cranial cavity, that is enclosed space that is formed by the cranial bone. Okay, this cranial bone that forms the boundary of the cranial cavity. So this cavity, can you see here this is the sagittal section. Can you see here the space here? Can you see? So this space, so they are the bone of the skull. Okay, so this space enclosed by the cranial bone. So this is the cranial cavity. So facial bones means the bone of the face. Okay, this will be different. And the cranial bone means that is the bone that forms the brain box. Okay, this forms the brain box. So inside, see why this is brain box? Because brain, that is the space for the brain. Brain lies here, so it is the brain box. So the cranial bone forms the brain box, and the facial bones, they form the facial skeleton. So these are the facial bones. Okay, here also and inside also it is there. Okay, if you see the skull means this portion, that is the facial bone. Okay, so only the cranial bone, they forms the cranial cavity. Now we will know the name of the cranial bone that forms the cranial cavity. Okay, now facial bone is not needed here. So just you remember the skull bone is divided into two headings. Okay, two group skull bone we can divide into two. That is the cranial bone and the facial bone. Okay, you will see the 14 facial bone actually. So if you want to know 14, okay, while reading the bone it will come. And that is the cranial bone, only 8 cranial bones. So total bone in the skull, how many are there? 8 plus 14, 4 plus 8, 14 plus 8. Okay, so these are the 22 skull bone. Okay, so out of this, the 8 cranial bone, they forms the cranial cavity. Okay, so forms the cranial cavity. So this cranial cavity, next name for this is the brain box. As I have already explained here, the cranial bone forms the brain box. Okay, now 14 facial bones not needed here. Now just we'll see the bone of the cranial bone that forms the cranial cavity. Now see here. So just I am writing the name now first. Okay, and also see here. So the facial bone. So facial bone, it does not form here. See here. One number, frontal bone, parietal bone. Okay, just you have to remember the name because this bone forms the boundary of the cranial cavity. So next is the temporal bone. Then the next bone, that is the occipital bone. Then the next bone that helps in the formation of the cranial cavity is sphenoid bone. Then the next bone that forms the cranial, help in formation of the cranial cavity is ethmoid bone. how many are there? There should be 8, isn't it? So we have got a 2 parietal bone and we have got a 2 temporal bone. Now remaining all bone 1 1. Okay. So this forms your cranial cavity or boundary of the cranial cavity. So just remember that the cranial cavity, the boundary is by the bony element only. Okay, so the bone forms the boundary of the cranial cavity. Are you getting up here? Any confusion?
No, sir.
No confusion. Okay. Now see here. So just you remember the name of bone. Okay. So there are 8 bones. What are the names of bone? So frontal bone, 1 frontal bone, 2 parietal bone, 2 temporal bone, 1 occipital bone, 1 sphenoid bone, and 1 ethmoid bone. Okay. Now, okay. Now I'll try to saw this bone in the picture. Okay. I have one nice picture I have kept here. Okay. I'll try to saw this all bone in the picture now. Because you have to know, you have to identify the bone also. Okay. Now, okay. In this picture, we can see all the bone now. Now see, all bone we cannot see in this view, okay? Now see, we can see the sum of the bone here. See, you can see the frontal bone. See, can you see this bone here? Okay, I'll make it large, wait. So if original skull was there, it will be more easy for me, okay, to show you. Okay, when your college start, I will show that in the skull bone. Okay, now see here. So this blue color, this is the frontal bone. Okay, so frontal bone is here, and see some part of parietal bone you can see. See, are you seeing me? Can you see me? Okay.
Yes,
So I
sir.
saw in my head skull also. See this portion, that is your frontal bone. Okay, this portion of your skull or cranium, that will be formed by the frontal bone. Okay. Now see, on the either side here there will be the parietal bone. Okay, 1, 2. So 2 parietal bone, but frontal was 1 only. Okay, so 2 parietal bone. Then the one more bone is there in the back side, that is the occipital bone. In the posterior side there is the occipital bone. Okay, now in this side here, see, there is the 2 temporal bone. Okay, so this is the 2 temporal bone is here. So you can see in the here picture red color here. Okay, now next bone, next remaining bone, this sphenoid and the ethmoid bone. See here, you can see here this portion of the bone here. Can you see here this bone? Because this bone they lie inside, so it's very difficult to see from outside. Okay, so these are the ethmoid bone only. So this ethmoid bone. Okay, so actually this ethmoid bone, they form the lateral wall of the nasal cavity. So they are inside only. So some part only we can see here, and sphenoid also we can see in the small portion we can see here, this yellow color. Okay, so they will be in the base of the skull. We can see that bone. Okay, so these are the bone: frontal bone, parietal bone, temporal bone. This yellow color, this the sphenoid bone. This is the single bone only. Okay, the structure is like butterfly shape, so it extends from right to left. So it is saying here in 2 sides, but they are single bone. And ethmoid bone also. Okay, this is the single bone only. Okay, just remember. And occipital will be behind. Okay, if I have got a next good picture, I will show you that also. Okay, now see in this picture here. See, all most of the bones are visible. See, this is the frontal bone. Okay, now see behind there is the one single bone. This is the occipital bone, and you can see this is the 1/2 of parietal bone in 1/2. Next will be in next side. Okay, this is the parietal bone, and this reddish color, this is the temporal bone. In the one side, in the next side also there will be the temporal bone in next side. And this is the sphenoid bone. Okay, and ethmoid bone, some part is visible here, but it will be inside only, so it's difficult to see from outside. Okay, these are the bone. So this forms the cranial cavity. Okay, if any cross sectional is there, I'll show you that also. Now here you can see here. See, can you see this? Now see, this is the section. Section is given here. So this space is the cranial cavity only. Okay. So here frontal bone, parietal bone, occipital bone. Also this part, this is the temporal bone. So this yellow color, now this is the sphenoid bone. Okay. And now you can see the ethmoid bone here. Can you see this? This is the ethmoid bone.
Yes, sir.
Okay. Now almost all bone that is visible here. So only half is given here. Okay, next half we have removed to see the cranial cavity. Now say this is the cranial cavity. So this is the cavity where there you will find the brain and the meninges. Okay. Now see here. Name of the bone you know. Now cranial cavity. Now you see in this picture now. Now see this in this picture. See, just we have removed the roof of the cranial cavity. Okay, from here we have just given the transverse section we have given, and we have removed this upper part. So that upper part, that is the roof. Okay. Now here only you will see the base. Okay, of the cranial cavity. Okay. Now see, if you see the, so cranial cavity, there is a cranial roof. Okay. Roof. So that is also known as cranial wall, and the floor that is also known as base of. So now see, cranial cavity, it has got a roof also, base also, isn't it? So this is the base or floor of the cranial cavity. Thus we have cut it from this side, and just we have removed the roof. So that portion, that is the roof portion, is known as cranial wall, and the below portion, this is the floor. Okay. Now see here that there is the division on the division of the cranial cavity here. Okay, you will see the division. Okay. Now if you open the cranial cavity, now you will see the three division. Okay, three fossa on the base. Okay, so on the base consists of three fossa. So they are the anterior cranial fossa. Next is the posterior, and in between these two fossa there is the medial cranial fossa. Okay. So see here. Now see, I have kept the picture. Okay, highlighted picture here. Okay, now you see here. So this part of the base, so this yellowish part, so this is the anterior cranial fossa. Okay, this yellowish part, this is the anterior cranial fossa. And you can see this portion, this reddish color along with this orange color part of this base, this is the medial cranial fossa, and a brown portion of the fossa, this is the posterior cranial fossa. And this fossa, they lodges the different part of the brain. Now see, if you see the anterior cranial fossa, it lodges the frontal lobe of cerebrum. Okay, so the medial cranial fossa, it lodges, or it provides the space for the temporal lobe of cerebrum. Okay, so medial cranial fossa. Then the posterior cranial fossa, it lodges it lodges the occipital lobe of cerebrum. Along with this, it also lodges the brain stem, and the beginning part of spinal cord. Okay, that is the medulla only. Okay, just brain stem means, see here. So it consists of part of midbrain will be there. Okay, so here will be pons and here will be medulla. Then finally, the next content in the posterior cranial fossa, that is the cerebellum. Okay, so these are all structures. That is the brainstem, it will lie anteriorly, and the cerebellum, they lie posteriorly. So while reading the meninges, see again this posterior cranial fossa will divided into two actually. So here will be one fold of the meninges, that is the tentorium cerebelli. Okay. Now I am explaining this. I will tell that thing also. So tentorium cerebelli. This is the fold of the meningeal layer of. So just remember that is the fold of dura. Okay. So this fold of dura, the tentorium cerebelli, divides the posterior cranial fossa into two actually. Okay. So this fold divides the posterior cranial fossa into two. So this posterior cranial fossa just above the level of tentorium cerebelli, that is the supratentorial compartment, and just below that tentorium cerebelli, that is the infratentorial compartment. Okay, so compartment, and just below the tentorium cerebelli, that is the compartment. Now see, these two compartments, they are the part of posterior cranial fossa only. Okay, so there is one cotton is there, so partition is there. The thing that is the fibrous sheath that is formed by the fold of dura. So just below the dura, that is the infratentorial, just above that is the supratentorial. These two both are the part of posterior cranial fossa only. Now see, this occipital lobe of cerebrum, okay, this lies in the supratentorial part. Okay, and the remaining part, that is the brainstem and the cerebellum, it lies in the infratentorial compartment. Just remember this thing. Okay, just be familiar with this thing only. So the posterior cranial fossa again divided into two compartments. Okay, just below the tentorium cerebelli, that is the infratentorial compartment. Here you will find the cerebellum and the brainstem. Just above the tentorium cerebelli, here is the supratentorial compartment. Here you will find the occipital lobe of cerebrum. Cerebrum, that is the large brain. Okay, forebrain. Cerebellum, that is the hind brain. Okay, while reading the brain, you will come to know this thing. So this is about the division of the cranial cavity. So now as a whole, okay, as a whole, if you want to see the content of the cranial cavity, so if you want to see as a whole content, so we have divided the cranial cavity into different fossa. But if you see as a whole cranial cavity, the content will be meninges and the brain. Okay, see here. See the individual vertebra. See first the individual vertebra, then you will get to know about the vertebral canal or vertebral cavity. See here individual vertebra. See, there is the body. In the anterior aspect, you will find the body, thick part of the bone that forms the body of the vertebra. See, just behind the body, you will find one arc of the bone. Okay, this arc of the bone that bears the various processes and the facets. So this part of the vertebra, that is the spinal arc. Okay, so that if you see the component here in the single vertebra, you will find the two components. One is the body, next is the spinal arc. Just I'll write here. So body, arc. Then in between these two, you will find the vertebral. So see here. So this is the body. This is this thick part of the vertebra. This forms the body in the anterior aspect. Now just behind the body, you see, you will find one arc of the bone. Okay, that is the spinal arc. Now in between the spinal arc and the vertebra, so you will find one opening. Oh, there is no bone is there, so it's like a ring. So you can insert the finger from that vertebral foramen. So this part is the vertebral foramen. Okay. Now see, if you see the component of spinal arc, see here. So this spinal arc that is connected with the body by help of pedicle. So this connection, these two connections, they are the pedicle. Okay, they are the two connections. So they are the pedicle. So spinal arc consists of pedicle. Then the next component, see, from the pedicle, one flat piece of bone, it will go posteriorly, and from the both sides they will fuse together in the midline. So this part, so this portion of the bone, that is the lamina. Now see, if you see in the junction of the pedicel or pedicle and lamina, here you will see some structure coming on the lateral aspect, some structure going up, some structure they will going down. Okay, so these three structures you will find at the joining place of pedicle and the lamina. So this part. So here you will see the three bony projection, they are the process. So this process, they are transverse process, which is going laterally, which is projecting laterally. So process means, you know, I have already explained what do you mean by process. This is the bony sharp projection. So this is the transverse process projecting on the lateral side. See here, you can see this is the transverse process. So in this side also transverse process. So next is the extending upward and extending downward. So superior and inferior articular process. Superior and inferior process. Now in this part you can see this is the superior articular process, and this part of the bone, this is the inferior articular process, this is the transverse. So they are from the meeting place of lamina and the pedicle. Okay. Now one more process is there. See, the two lamina, they are fusing in the midline. In the posterior aspect, there is the one bony prominence from the meeting place of the two lamina on the midline. This is the spinal process. So this is the spinous process or spinal process. Okay. So next process is the, just you remember the part of this bone. Okay. So my intention is to explain the vertebral foramen and the vertebral canal. Now see here. Now you see the vertebral foramen in each vertebra. Okay. So almost the structure of most of the vertebra, they are similar. Okay. Some vertebra they have got a different. Okay. But see some, now this is the general structure of the vertebra. Now there is the vertebral foramen. Now just remember that. So if you make the pile of all the individual vertebra, means what will happen? See this foramen, it will convert into one tubular canal, isn't it? Isn't it? So that tubular canal, that itself is known as vertebral canal. Now see here, we are keeping one vertebra above other vertebra. So this all vertebra, 12, 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, okay, and 4 coccygeal vertebra. If we keep one above another, means what will happen? This foramen, they will convert into one tubular canal, isn't it? So that tubular canal itself is known as vertebral canal. Are you getting?
Yes, sir.
Okay, so that is the vertebral canal. So this is the dorsal body cavity. Okay, so if you keep the one vertebra above another vertebra, so the vertebral foramen, okay, they will convert into the one tubular canal. That canal is the vertebral canal, and this vertebral canal, it consists of the spinal cord. So this is the spinal cord and its meninges. So this is the major content of the vertebral canal. And other content, they are the root, spinal nerve, and the rami. Root and rami also you can write here. So actually what will happen, see here, from the spinal cord, just I will try to show you this picture in the diagram. Suppose this is the spinal cord is here. Suppose this is the cross section of spinal cord. So this spinal cord will be in the inside the just I'll draw here inside only. Okay, so this is the spinal cord, suppose. Okay, so spinal cord is covered by the membrane, so that is the meninges. Okay, so the meninges of the spinal cord. So what will happen from spinal cord? See, spinal nerve will come out. Okay, so one root will come out here, next root will come out. They are the root of the spinal nerve, and they will unite together to form the spinal nerve. Okay, then finally they will convert into the rami. So this cavity, it also consists of spinal cord and its meninges. Then the spinal nerve. Spinal nerve. Okay, here in the spinal nerve, you will see the all part of spinal nerve. You will not, now you will not see here. You will see the root. You will see, and also you will see the ganglia also. Okay. Just you remember the beginning of spinal nerve you can write here. Okay. So the root and the dorsal nerve root ganglia or a root of spinal nerve you will see in this part. Okay. After that, the spinal nerve they will come out and they will divide into posterior rami and ventral rami. Okay. You will not see that thing inside. So only here you will see the beginning of spinal nerve. Okay. So just remember that is the ventral body cavity. That is the vertebral canal. So this vertebral canal that is formed by the series of vertebral foramen, okay, that is converted into the vertebral canal that encloses the spinal cord and the meninges that covers the spinal cord. So that is the content of the dorsal body cavity, that is specially vertebral canal. So these two are the dorsal body cavities. Okay, up to here any confusion?
No, sir.
If no confusion, then we will go for the next, that is the ventral body cavity. Now see here, ventral body cavity, as you already know that we have got a two division of the ventral body cavities. So see here in the trunk region, this region. So in the trunk region, this ventral body cavity, see it has got a two parts, especially thoracic cavity and the abdominopelvic cavity. Okay, if you write the abdominal cavity and pelvic cavity separately, it will be 3. Okay, that is also okay. Okay, I am writing the abdominopelvic cavity and 1 because there is no partition, there is no wall between these two cavities, because these two cavities they will directly communicate with each other. But thoracic cavity, it will not communicate with the abdominal cavity. There is the partition is there, there is a wall is there. Okay, so that wall is there, that is why the diaphragm is there. So out of these two ventral body cavity, now we see the thoracic cavity. See, you can see this Bliss said, so this is the cavity, that is the thoracic cavity. Now we'll see the wall of thoracic cavity now. So first body cavity, that is the A number, okay, that is A number under ventral body cavity, thoracic body cavity. Now we have to see the wall. Okay. Now see, as you have already seen that in the cranial cavity, the wall is entirely formed by the bone. Okay. You will not find the muscle there. Okay. First bone will form the cavity. But in case of thoracic cavity, the musculoskeletal element, both the bone, muscles and the cartilage also, they will form the boundary of the thoracic cavity. Okay. So here if you see in the wall of the thoracic cavity, you will see the musculoskeletal element. Both the muscles and the bones, they forms the wall of the thoracic cavity. Muscle and forms the wall of the cavity. Now we'll see the thoracic cavity. Now see, for easy understanding, we can read the thoracic cavity under this heading. See here. See, we'll see the boundary or wall. Boundary or wall, okay? Wall. Then we'll see the inlets. Inlet of thorax. Then we'll see the outlet of thorax. This is 3 number, okay? Outlet of thorax. Now see here in this picture here. So this is the thoracic cavity. Okay, now I'll go for the previous picture here, that is more clear. Okay. Okay, now see here in this picture now. So this is the thoracic cavity only. So bone are there. See, in between bone there is the space, but in this space there is the muscles is there. So bony and muscular element both forms the thoracic cavity. Now see here, this whole thing that is the thoracic cavity. So this thoracic cavity, that bone forms the thoracic case, okay, and the space between the bony element that is filled up by the muscles, okay, that muscles will be there in between this bony element. So this is the space only is there. Now this is filled up by the muscles. So this is the intercostal muscles will be there. Okay, different group of intercostal muscles are there. So they forms the wall. Now see, for easy understanding, so you can read this thoracic cavity under three subheadings. So wall. First we'll read in the wall. What are the structures? They forms the wall. Okay, what will be there in the wall? The next is the inlet. See, you can see here. This here is the circular opening is there in the thorax. Okay. So through this opening, this thoracic cavity, it will communicate with the neck. Okay, means that opening through this opening only the structure coming from the neck they will go inside the thoracic cavity, or the structures from the thoracic cavity will come towards the neck. So this is the inlet. Okay, so this is the inlet of thoracic cavity. Now next is the outlet. Outlet means this portion. So this this is the lower limit or lower opening in the thoracic cavity. Actually there will not be opening. That opening is guarded by the some fibromuscular septum. That muscular septum is there, so that is diaphragm is there. Okay, so the lower opening in the thoracic case, that is the outlet of thorax. So from the outlet there are some small opening in there in the diaphragm. Okay, through that opening some vessels they will go towards the abdominal cavity. Okay, and the vein and the lymph duct they will come towards the thoracic cavity. So they forms the gateway actually. Okay, so under these three headings we will read. Now first we'll see the boundary here or wall. Now see here in the wall, now wall, okay. If you see the wall, now, so there is different structures present in the different part of the wall, okay. So if you see in the anterior midline, the different bone is present. If you see in the lateral aspect and the anterior lateral aspect and the posterior lateral aspect, you will find the different bone. And if you see in the posterior midline, you will see the different structure. Okay, so thus we'll see in the anterior midline first. In the anterior midline part, there is different structure. So in lateral part, there is different structure. In the posterior midline, you will find the different structure. Okay, now see here. So this is the middle, isn't it? And this is the anterior aspect, and behind is the posterior aspect. See, in the anterior aspect, only the middle portion, in the only midline portion, you will find the sternum here. But in the lateral aspect, you will find the other bone, they are ribs. Okay, so the anterior midline part of the wall that is formed by the sternum. Sternum. Okay, see, this is the sternum here. So this is the flat bone present in the anterior midline aspect of the thoracic cavity. So this is the sternum. So sternum has got a three part again. The upper part, this is the manubrium. So this flat part in the middle, this is the body of sternum, and the lower pointed part, that is the xiphoid process. Okay, while reading the individual bone, it will come. Thus, you remember now in the anterior midline portion, the thoracic wall is formed by the sternum. Now, see in the lateral part, actually in the anterior lateral part, and the posterior lateral part, actually that is okay. So this part, the bony element from this part is by the ribs. Okay, ribs and adjoining costal cartilage. Okay, see here. Now see in between the ribs and the sternum, you will find this bluish structure. This is the cartilage only. So they are the costal cartilage. Okay, on the both side. Okay, so on the both side. But anterior midline, this is a single structure. Okay, in the lateral part, in the both sides, there are the ribs and the on the both side, on the right side also, on the left side also. So you will find in the both side you will find the ribs and the adjoining costal cartilage. So there are 12 ribs are there. So 12 ribs. Just you can write 12 in each side. So that forms the skeletal element. Skeletal. So that is the skeletal part. Now see, in between the two ribs there are spaces there. Now this space is not left space. Okay, this space is covered by the muscle. Okay, so there is the muscular element also. So here there is the extension of muscle also. So now the muscular element is formed by the intercostal muscle. Muscle in intercostal space, intercostal muscles. Okay, that forms the muscular element. So that forms the muscular part of the wall. So lateral wall you will find the bony and the muscles both. So bony component that is formed by the bony component that is formed by the ribs and the adjoining costal cartilages, whereas the muscular component of the lateral wall that is formed by the intercostal muscles. Okay, there are the anterior intercostal muscle. Okay, sorry, outer intercostal muscle, inner intercostal muscle, innermost intercostal muscles. Okay, so like that. So different groups are there. Okay, just remember the intercostal muscles. Okay, then the in the posterior midline. So in the posterior midline, the wall of thoracic cavity that is formed by the thoracic vertebra. And adjoining intervertebral disc. Okay, so there are two-way thoracic vertebra. Okay, so just write here two-way thoracic vertebra and adjoining intervertebral disc. So that forms the posterior boundary of the wall. Now I will show this thing in the picture. Now see here anterior you can see here wall. In this picture anterior and lateral you can see, isn't it? So lateral there bones are there and in between this. So this is the intercostal space actually. This space is filled up by the muscles. Muscles are there. Okay, so this is the anterior and the lateral. Now posterior here you can see. See here the posterior boundary that is by the vertebra. So that vertebra that is only the thoracic vertebra that forms the posterior midline boundary of the thoracic cavity, including the intervertebral disc. Now you can see in between the two vertebral body, you will see the thin piece of cartilage here. So this thin piece of circular, that is the fibrocartilage, that is the intervertebral disc. Okay, okay up to here. Okay.
Yes, sir.
Okay. Then today I will do up to here only. Okay. So tomorrow we'll see the thoracic inlet. So it's easy only. Okay. Thoracic inlet, thoracic outlet. Okay. Then structure forming the thoracic inlet. Everything we'll see in the next class. Okay. Yesterday we are reading about the body cavities, isn't it? So the body cavities is classified into two categories of body cavities. They are the ventral and the dorsal body cavity. So dorsal body cavity, cranial cavity, and the vertebral cavity, that we have already explained this thing. Now we are going for the ventral body cavity. Under ventral body cavity also, so major classification of ventral body cavity you can do under two headings, that is the thoracic cavity and the abdominal pelvic cavity, or you can do the thoracic cavity, abdominal cavity, and the pelvic cavity. Okay, because actually this abdominal and the pelvic cavity, they communicate with each other freely. Okay, there is free communication. So I have kept this under the common heading, that is the abdominal pelvic cavity. Okay. Now we are going for the thoracic cavity. Okay. So yesterday I have already explained that the thoracic cavity we can read under the three headings. That is the thoracic inlet, thoracic wall. Okay. And next one is the thoracic outlet, isn't it? So we are seeing the thoracic wall. Okay. So our heading will be thoracic wall, inlet of thorax, then outlet of thorax. So under this heading we are going to read this thoracic cavity. See, almost the structural framework of the wall we have already studied. Okay, so that it has got a both muscular component also and the skeletal element also. So skeletal elements, in the anterior midline there was the sternum, isn't it? So in the lateral aspect you will find the ribs and the adjoining costal cartilage, and in the posterior midline you will find the two-well thoracic vertebra and the adjoining intervertebral disc, isn't it? So I have already mentioned this thing, or shall I write again? So thoracic wall is formed by the skeletal element also. Next one is the, so it consists of both skeletal-muscular element forms the thoracic wall. So under the skeletal element you will find the sternum, rib and the vertebra. Okay, so in the anterior midline, so there is the sternum. Then the either side, that is on the either side, on the right and the left lateral side, okay, or lateral side, both lateral side. The wall is formed by the ribs and adjoining cartilage. Okay, see there are 12 pairs of ribs. Okay, in one side there are 12, next side there are 12. So 12 pairs of ribs. Okay, 12. Total 24. Directly I will write 24 or 12 plus 12. That is better. 12 in one side, 12 in one side. So 12 plus 12. Okay, are you getting up here? Then the posterior midline. Posterior midline. So the posterior midline is structure on the thoracic wall that is formed by the tubular thoracic vertebra and adjoining intervertebral up to here almost we have already completed. Okay, so this is the revision only. So in the posterior midline you will find the tubular thoracic vertebra and the adjoining intervertebral disc. In between the two vertebral body you will find the one fibrocartilage disc, that is the intervertebral disc. So the muscular element you will find here, that is the intercostal group of muscles. Muscles that occupy the intercostal space. Okay, so here you can see the bone, you can see the skeletal framework of the thorax, you can see this is thoracic cage. Okay, that is the bony component in the thoracic wall. So in between this bony ribs, see space is there, intercostal space, this is filled up by the muscular element. So they are the intercostal muscles will be there. So remember that. So intercostal muscles, they forms the help in the formation of the thoracic wall. So they are the muscular element. Now see, there was the sternum. So sternum in the midline. Okay, that is a flat bone. Okay, but see here they are the ribs. The ribs are there in 12 pairs. Okay, 12 in one side and 12 in next side. So 12 pairs of ribs are there. See these ribs can be classified into 3 groups. Okay, classification of pairs of ribs. Now see here, these ribs we can classify under 3 headings. Okay, these are 12 pairs of ribs. So these all ribs we can classify into 3 headings. Okay, 3 groups. Okay, so 3 groups are there. So first is the true ribs. True ribs. Okay, next name I will give for this also. So next one is the false ribs. Then the third one we can categorize under floating. Okay, so what is true ribs? See here, so true ribs, actually this all, see most of the ribs they have got an anterior attachment and the posterior attachment. So these true ribs they have got a free attachment. So it has got a free anterior attachment, also free posterior attachment. Okay, so anterior attachment is along the sternum. Okay, posterior attachment is on the vertebral body. Okay, so see, if you see this rib, see here, it has got the posterior attachment on the vertebral body, then the anterior attachment with the sternum. Okay, with the help of posterior cartilage. So separately they are attaching in the posterior also, anterior also. See the second ribs also separately. Third ribs also separate. See anterior attachment. See the fourth ribs. See the fifth. See the sixth. see the 7. So they are independently attached with the sternum, isn't it? So anteriorly they are independently attached, and similarly in the posteriorly also they are independently attached. So true ribs, they have got a independent attachment over the vertebral body and the sternum. Okay, these types of ribs, they are the true ribs. So the names of this next name for this ribs is known as vertebro-sternal. So anteriorly they are attached with the sternum independently with help of costal cartilage, and posteriorly attached to the vertebral body. So these two ribs are known as vertebro-sternal, vertebra and sternum. See, posteriorly vertebra and anteriorly to the sternum with the help of costal cartilage. Okay, free attachments are there. So these types of ribs, they are true ribs. So first rib, second rib, third rib, fourth rib, fifth, sixth and seventh rib. Okay, first to seventh ribs, they are the true ribs. Okay, so they have got an independent attachment with the sternum with the help of costal cartilage. This bluish piece, this is the costal cartilage only. So this is the ribs. First, second, see independent attachment with the sternum, third, fourth, fifth, sixth, seventh. So they are separately attached here. Okay, independent attachment is there. So they are the vertebro-sternal ribs. So the first 7 pairs of the rib, okay, on the right side also on the left side. So first 7 rib on the right, first 7 on the left means they are the first 7 pairs of the rib. They are the true ribs. Okay. Then the false ribs, see, they have got a name vertebrochondral ribs. Okay. So the false ribs, it has got a name chondral ribs. Now see here why they are vertebrochondral ribs. So these ribs behind the 7, so that is the 8, 9 and 10. Okay, so see here why vertebrochondral, see posteriorly they are attached with the vertebra, okay. Okay, independently attached with the vertebra, that is okay. But anteriorly, see, if you see this 8, 9, 10 rib, see this 8th rib, this is not attached with the sternum. So rather it is attached with the help of costal cartilage with the 7th rib. This is the costal cartilage of 7th rib. Okay. So 8th rib is attached with the help of costal cartilage with the costal cartilage of 7. Similarly, see 9th rib, it is attached with the help of costal cartilage with the 8th. And similarly 10th is attached with the 9th, isn't it? So they are attached with the costal cartilage of higher vertebra. Sorry, higher ribs, isn't it? So they are the false rib or vertebrochondral rib. So posteriorly they are attached to the vertebra, anteriorly attached with the costal cartilage. Chondral means cartilage here. Chondral or cartilage of the higher rib, isn't it? So 8 is attached with the costal cartilage of 7, 9 is attached with the costal cartilage of 8, 10 is attached with the costal cartilage of 9. So these 3 ribs, 3 pairs of the ribs, okay, 3 in the right side, 3 in the left. So these ribs, they are the false rib. Okay, so 8, 9 and 10th rib, they are the false rib. Okay, up here. Then finally there is 2 pairs of ribs, they are floating ribs. Okay, floating ribs, see, they have got an attachment in the posterior end also only. So only the posterior end of the ribs is attached with the vertebra, but anteriorly there is no attachment. So anteriorly is free floating, they are free only. See here you can see the anterior end, they are not attached with any vertebra. So these 2 ribs, they are the floating ribs. So this is known as vertebral ribs, only attachment on the vertebra. On the posterior side only it is attached with the vertebra, but anteriorly it is free. There is no attachment. So anterior end is free. So they are the floating ribs. So the 11 and 12th ribs, they are floating ribs. Okay, up to here. So they are the classification. So true ribs, false ribs, floating ribs, false rib and the floating ribs. So first 7 pair, they are the true ribs, 8, 9 and 10 pairs, they are the false ribs, and the 10th and 11th, they are the floating ribs. Now see here, one more thing is there, the costal cartilage of 7, okay. Now the next one is the costal cartilage of 7, 8, 9 and 10 forms the costal margin. See here, this costal margin that is formed by the 7, 8, 9 and 10 costal cartilage, okay, or the costal cartilage of 7, 8, 9, 10, 3, that forms the costal margin, okay. Are you getting? So just remember this thing, okay. Now margin, not E, okay. So this is about the ribs, okay. Now see, so almost the thoracic wall and the structure on the thoracic wall, it is over only, okay. Now we will see the other component, that is thoracic inlet and thoracic outlet. So see here you can see the ribs here. Let's see here, see first rib, see anterior attachment with the sternum freely, posteriorly with the vertebra. See posterior attachment is free, second rib. See free attachment on the anterior aspect with help of costal cartilage with the sternum. See independent attachment is there. 1, 2, 3, 4, 5, 6, 7. Independently they are attached. But see after 7, see 8th rib, see it is not attached with the sternum. It is attached with the costal cartilage of 7. See this is attached with the 7. 9 is attached with the 8. 8 is attached with the 9. Sorry, 10 is attached with the 9. So these 3 they are the false rib. Remaining see these 2 ribs, see posteriorly they are attached, but anteriorly are free. Posteriorly it is attached, anteriorly it is free. So if this is 11, this is the 12. So they are the floating ribs. Okay. Are you getting?
Yes, sir.
So now see, now if you see this is the wall of thoracic cavity. How this is formed, you already know now. Now see, if you see the shape of thoracic cavity, the shape is like truncated cone. Okay, what do you mean by truncated cone? See, if you see the shape of thoracic cavity, so it is like truncated cone. Truncated cone means the cone without apex. See here, suppose, so this is the cone, isn't it? So if I extend it and make the point here, so it is cone, isn't it? So if you remove the apex from the cone, so this is the truncated cone. Okay, so it is the cone having the blunt apex. So this is the truncated cone. Just remove the apex. Now see if this is the structure of cone, isn't it? So if you remove the apex portion, so it will be now truncated. So this is the truncated cone. So now it has got a blunt apex. Okay. So if you see the thoracic cavity is like that only. So this is like conical shape with the blunt apex. So this in the blunt apex you will find the opening here. Okay, there is opening is there, and you will find next opening below here also. Okay, so it is the truncated shape with the blunt apex, and in the apex, blunt apex you will find the opening. Here is also one opening will be there. In the base of this cone there is next opening. So this is the apex, that is the blunt apex with the opening, and this is the next. Okay, so it will not be circular, it will be somewhat different shape. Okay, so here will be next opening. Okay, so 2 opening will be there. Now see these 2 opening. So in the apex end, at the blunt apex end, the opening that is the thoracic inlet. And the next, that which is below, that is the thoracic outlet. So this thoracic inlet and the thoracic outlet has got a next name. The thoracic inlet, the name is the superior thoracic aperture. Then the thoracic outlet is has the next name, inferior thoracic aperture. Just you note the name now. Okay. So, and this is the wall only. So these are the wall of the truncated cone. So that is the wall of thorax. So this is the wall. Okay. Now wall we have already seen. Now we see the inlet and outlet. Before that, see, if you see the transverse section, means see, if you cut the thorax by transverse plane, you know the transverse plane, isn't it? See, you can see in the diagram, see, I have drawn one plane, one line, the horizontal line. If you cut the thorax like this, and if you observe the thoracic cavity from above, okay, if you observe from here, okay, after cutting and removing this upper part, then it seems like this. So the bean shape or kidney shape, see here the shape, so it's the kidney shape, isn't it, or bean shape. Okay, just remember that. And the thoracic, it has got the transverse diameter of the thoracic cavity. So the transverse section that gives the bean shape appearance to the thoracic cavity. So if you measure the transverse diameter of the thoracic cavity, that is larger than anterior posterior diameter. Okay. Suppose this line, this is the anterior range, is this posterior. So this is the anterior posterior, and this is the transverse. So always remember, the anterior posterior diameter is smaller than the transverse diameter of the thoracic cavity. Okay, in the case of adult, I am explaining here. Okay, so bean shape on transverse section. So the diameter, transverse diameter is greater than anterior posterior diameter. Just you remember this point. Okay. So this is about the thoracic cavity. Now we'll see the inlet and outlet. Okay. Now we'll see the thoracic inlet, how this thoracic inlet is formed, and what are the structures they will pass from the thoracic inlet, and what are the structures they will leave out from this inlet, and what is there, which structures cover that, and what is the structure just above the thoracic inlet. This thing we'll see now. Okay. Now we'll go for the next heading, that is the thoracic inlet or superior thoracic aperture. So now we are going to see this. Okay, what is the boundary, all things. Okay, superior thoracic aperture, that is the thoracic inlet only, same. Okay, thoracic inlet. Now see here, see, just I have kept here the thoracic inlet only. Okay, so see in the initial picture here. So this portion just I have cut here and kept the inlet only. Okay. See here. So this is the thoracic inlet. Okay. So this thoracic inlet, see, make the communication between the root of neck and the thoracic cavity. Okay. So just above there is the neck, isn't it? So this is the neck. Head is here, neck is here, thorax is below. So this is the neck. So here there is the opening, there is communication is there in between the root of the neck and the thoracic cavity by this opening is there. So this opening is not large. Okay, actually this is covered by some membrane. I will explain that thing also. So it forms, make the communication between the thoracic cavity is here and above is the neck. So it forms the communication between the root of the neck and the thoracic cavity. So that is the thoracic inlet. So see, if you see the boundary of thoracic inlet, so it forms the between neck and thoracic cavity. Okay, so through this opening only the various neurovascular structure they will pass between the neck and the thorax. Okay, just I'll write that also. So through this opening opening various neurovascular structure. Okay. Various neurovascular structure passes, just I'll let that. Okay. So now we'll see the boundary. Okay, what is the boundary of the thoracic inlet? Now you have to see the boundary. Now see here, this opening is the thoracic inlet only. Now this bone, they are forming the boundary, isn't it? Now how this boundary is formed? Now see here, posteriorly see the upper border of the body of first thoracic vertebra, posteriorly. Then anteriorly the upper margin of the manubrium of the sternum. And on the either side, so the boundary is formed by the inner border of the first rib and the adjoining costal cartilage. So the boundary, see here, posteriorly upper border of T1, upper border of body of T1, that is the first thoracic vertebra. Okay, T1 means body of first thoracic vertebra, that means T1. Then anteriorly upper border of manubrium of the sternum. Okay, so this is the manubrium. While reading the sternum, it has got a three-part manubrium, the sternal body, and the xiphoid process. So this is the manubrium only. So this is the upper border of the manubrium. So the lateral border of the thoracic inlet, that is formed by the inner border of first ribs and adjoining costal cartilage. So see this blue piece, this is the costal cartilage. So first costal cartilage. So the inner border of the first rib and the adjoining costal cartilage, that forms the two lateral border of the thoracic inlet. Okay. So better write two lateral borders. Okay. In this side also, this side also. So anteriorly manubrium, there is the T1 vertebra. So this forms the boundary of the thoracic inlet. Now see, if you see the plane of thoracic inlet, see this opening in the thoracic cavity is not horizontal. So rather it is tilted forward like this. So opening will be like this. Okay, it will not be like this. Okay, it will be like this. See here. Suppose this is the thoracic inlet. Okay, it is not horizontal actually. This opening is not horizontal. This opening is like this. Okay, it's slightly tilted forward and downward. Okay, so the plane of thoracic inlet, that is directed downward and forward. Okay, so see, plane of downward and forward. So it is not horizontal. The opening will not be, is not horizontal. So as you already know, you can see this. Can you see? Can you see me? See? Suppose this is the thoracic cavity. Suppose, okay. Now see, this is the thoracic inlet. Here is the thoracic outlet. So the cavity is there. That is the thoracic cavity. Suppose, okay. Now see here, this upper opening, that is the thoracic inlet. This thoracic inlet is not horizontal. Rather, it is directed. See, it is slightly tilted forward and downward. This opening is tilted downward and forward. Okay. See here. Now see the below picture. See the angulation formed by this in plane of thoracic inlet is 45 degree. So this tilted in a such a way that this forms the angle 45 degree with the horizontal. Okay. Now see here. So this is the posterior boundary. This is the anterior boundary. So it is tilted. See here. They are not horizontal. So the opening is tilted forward and downward. So this is the front side. Now see this tilting, that forms the angle 45 degree. Okay. So forms the angle of 45 degree. Okay. Just I will write 45 D. Okay. Just you write the degree. 45. Okay. Degree So now see, now I am going to tell why they are tilted. Okay, why the opening is tilted forward? Because see, if you see the anterior wall and the posterior wall of thoracic inlet, see the anterior wall is lie below than the posterior wall. Because see this anterior wall and posterior wall does not lie in the same level. See here, posterior wall is higher. So the anterior wall and posterior wall, they are not in same level. The posterior wall lies higher than the anterior wall. So that what will happen, the opening is directed forward and downward. So the cause of this tilting is the level of anterior wall is below than the posterior wall. That means posterior wall lie higher or lie at the higher level than the anterior wall, isn't it? That is the same thing. Okay, you can note this point. Okay, because the level of the posterior wall, level of posterior wall, it lies at the higher level, but anterior is below. See, it does not lie in the same level, isn't it? So this is the anterior wall. So this is the posterior. This is the upper border of the body of first thoracic vertebra. This is the upper border of the manubrium. So this one. So they will lie in the different level. So due to that only. Now see. So due to that, there is the angulation in the inlet of plane of inlet of thorax. So that is 45-degree angulation is there. Now see one more thing. See now, actually the posterior wall, it lies almost so 1.5 inch above than the anterior end. See this anterior end is below, posterior end is above. So if you measure the height between the anterior end and the posterior end, it is almost 1.5 inch. Okay. So now here so this is the anterior end, this is the posterior end. So it is tilted like that. So this lies higher, posterior end lies at the higher level. So almost 1.5 centimeter above the anterior end. So the posterior wall lies 1.5 inch. Okay. Then so that is almost, if you want to write in centimeter, this is 3.7 centimeter. Okay. Okay, so the posterior wall lies 3 centimeter above the anterior wall. Okay. So due to that, there is the angulation in the plane of inlet of thorax. So 45 degree. Now if you draw the horizontal line at the level of anterior end of the wall posteriorly, then it reaches at the level of T3 vertebra. Just you remember the upper border of the manubrium sterni that lies at the level of upper border of body of so write this, the upper border of the manubrium lies at the level of upper border of body of third thoracic vertebra. So see the upper border of the manubrium, if you draw the horizontal line, it reaches at the upper border of the T3 vertebra. Just you remember this thing. Okay. Okay, this is the boundary and the direction of the inlet of thorax. Okay, how it is tilted, at what angle it is tilted. Okay, what is the relation between the anterior wall and the posterior wall. Okay. Then next, see here, we'll go further. Now see, actually see, this thoracic inlet, actually this is covered by the one piece of membrane actually. There you will find the diaphragm here. Okay, there you will find the membrane, fibrous membrane you will find. Okay, just I'll try to draw here, this membrane here. So actually this membrane, they are in two half. Okay, so two half. So almost the shape will be the triangular in shape. Okay, so almost like this. Okay, so similarly in this side also, the membrane will be in like this shape. So actually there the opening is not large. Okay, this opening is covered by the membrane so that the opening is converted into the thin slit like opening and which lies in between the two diaphragm. Okay, only the opening lies in between these two diaphragm. Okay, now see in the next picture also the diaphragm. So the name of this diaphragm, okay, so this is the triangular sheath, okay, or the triangular diaphragm that guards the or that covers the thoracic inlet. Okay, and the shape of this diaphragm that is triangular in shape. Okay, now see here, you can see here this color here, purple color here. Okay, one is here, similarly one will be here. So what will happen? See, initially it was the large opening in the inlet, but now see in presence of this diaphragm, now the opening is converted into the midline opening. Okay, midline. So the communication between the neck and the thoracic cavity lies in the midline. So it's like thin slit like opening only. So this membrane that acts as a diaphragm. So there we will find the two half of the diaphragm. Okay, guarding the half diaphragm covers the thoracic inlet. Okay, so these two half of this diaphragm, the name of this diaphragm that is the Simpson's fascia or suprapleural membrane. Pleural or the next name for that is the Simpson's. So this is the fibrous tissue. This is the sheath of fibrous tissue. Okay, the shape of this fibrous tissue that is triangular in shape. So each half it has got a triangular in shape. Okay, so apex lies in the upper part, whereas the base lies in the lower part. So apex, so it is in the triangular shape. Just remember that it is the fibrous tissue. Okay, the fibrous sheath. Okay. Okay, triangular better you like. Fibrous sheath. Okay, that guards the thoracic inlet. Okay, now it has got a triangular shape, so it has got a base. So base is attached with the inner border of the first rib and the costal cartilage, whereas the apex is attached to the transverse process of the C7 cervical vertebra. See, just see here see, this is the base portion. Okay, so this is the base and this is the apex. Okay, the apex is attached with the transverse process of C7 vertebra, whereas the base is attached with the inner border of the first rib and the adjoining costal cartilage. See here, you can see in this next picture, can you see this green color here, green color line here? So that represents the attachment of the Simpson's fascia along the inner border of the first rib. So here, see, this is the green color. So that is the line of attachment of the suprapleural membrane or Simpson's fascia. So triangular in shape, it has got a, so the attachment, so apex is attached with the, apex attached to the okay, we'll start then now. Now see, so this diaphragm on the thoracic inlet, okay, they are in two half, so they forms the cleft like or slit like opening in midline. Okay, through that the thoracic cavity and neck, root of neck will communicate. Okay, the structure passing between the thoracic cavity and the root of the neck, they will pass along this opening only. Okay, remaining portion on the other side, they are covered by the triangular fibrous sheath, that is the Simpson's fascia. So they are in two half. This diaphragm, they are in two half. One half in the right side, one half in the left side. So name is the suprapleural membrane or Simpson's fascia, triangular in shape, apex attached with the transverse process of the seven cervical vertebra, whereas the base is attached. Now see, base is attached along the inner border of the first rib, along with the adjoining costal cartilage. So base of Simpson's fascia, so attached with the border of the first ribs and adjoining costal cartilage. Now see here in the next picture, you can see the site of attachment of the Simpson's fascia. This green color that represents the line of attachment of the Simpson's fascia along the inner border of the first rib. Okay, so this is the attachment. If you now see, so the Simpson's fascia, just below the Simpson's fascia, so you will find you will find the pleura. There is the cervical part of the parietal pleura, you will find just below there. Okay, so the cervical part of parietal pleura is attached on the inferior surface of this Simpson's fascia. If you just remove the Simpson's fascia, and just immediately below that you will find the cervical part of parietal pleura. Okay, and if you got that parietal pleura, you will find the apex of the lungs. Okay, just remember this thing. So immediately below you will find the cervical part of parietal pleura. Or just remember the inferiorly surface of the suprapleural membrane is adherent with the cervical pleura or attached with the cervical pleura. Just remember that thing. So actually after removing, see this two different color. This color actually this is representation for the cervical part of parietal pleura, and this is the Simpson's fascia. Just after removing this thing, you will see this thing. Okay, in this side actually they have removed the Simpson's fascia. Okay, so just below there you will find the cervical part of parietal pleura. Okay, while reading the pleura it will come, don't worry. Just be familiar with this thing. Now, so see here, now through this inlet, so the structure they pass from the root of the neck to the thoracic cavity. See here, see from the heart, the greater vessels, they will come out and they will pass along the neck. So basically internal carotid artery, or just let's say common carotid artery, they will pass along this route. Okay, jugular, internal jugular vein, they will pass along this route. So vagus nerve will pass along this route. Okay, so various structures will pass from this route. So this forms the pathway for the passage of neurovascular structure between the thorax and the neck. Okay, so just you write that it forms this cleft. Okay, between the Simpson's fascia, that forms the pathway. Okay, passage of various neuro between root of neck and thoracic. Just remember this thing. Okay, so through this path only. Okay, the various neurovascular structure. Okay, the vessels, nerve. Okay, they will go in and out from that inlet. So this is about the thoracic inlet. Okay, up to here. Now we'll go for the next, that is the thoracic outlet. Okay, so here also this is the thoracic inlet only. So see, so vessels, they are coming out from the thoracic inlet. See here you can see the subclavian vessels, you can see here. Okay, so various structures, the vessels will come out and nerve will come out. Okay, or nerve vessels will go in Okay, vein will go in like that. So that forms the highway. Now next heading, that is the thoracic outlet. So here in the diagram you can see the outline of thoracic outlet. Okay, so here was the thoracic inlet, or superior thoracic aperture. Now this is the inferior thoracic aperture. So if you see the inferior thoracic aperture, so it is, the size is comparatively larger than superior thoracic aperture. Okay, isn't it? Now we'll see the boundary here. Okay, so inferior thoracic aperture, the next name for this, that is the outlet of thorax. So this outlet of thorax, if you see the boundary here, so you will find this boundary. This is the costal margin. So this costal margin on the both sides, that forms the anterior boundary. And the posteriorly, see, you will find the lower border of the 12th rib and the lower border of the body of 12th thoracic vertebra. Okay, that forms the inferior thoracic aperture. Okay, so the boundary, see here. Okay, on the both side, on the both half, right and left half. Okay, similar. So boundary is formed by the costal margin, then lower border of 12 ribs and lower border of body of 12 thoracic. So that forms the inferior thoracic inlet or outlet boundary. Okay, so this is the costal margin only. So the costal margin, so in the right side, see the costal margin is formed by the costal cartilage of 7, 8, 9 and 10. So this is the costal margin only. Okay. Now see here, behind, see, there is the lower border of the 12 vertebra, then there is the 12th rib, that is the lower border of the 12th rib. Okay. So that forms the inferior thoracic aperture, just remember that. Now see here, in the superior thoracic aperture there was the diaphragm. Okay, so the diaphragm initially they are in the two half, but in case of inferior thoracic aperture, so this inferior thoracic aperture that also consists of the diaphragm. Okay, so it is covered by the diaphragm, covered by the diaphragm. So the nature of diaphragm, that is the musculotendinous diaphragm. Okay, so that is the thoraco-abdominal diaphragm. So this diaphragm, so there is no direct communication, okay, between the thoracic cavity and the abdominal cavity. There is no communication. There is a partition is there. There is a wall is there. So that wall is formed by the thoraco-abdominal diaphragm. This thoraco-abdominal diaphragm generally we are calling the diaphragm. Okay, so this diaphragm, that is the actually muscles of respiration actually. So this is the flat circular sheath of muscle. Okay, muscles. Okay, and in the center, the all muscles converge into the tendon. So we are telling the musculotendinous diaphragm. Okay, so there is the partition. Dome of diaphragm is there. So that forms the partition between the thoracic cavity and the abdominal cavity. So the inferior thoracic aperture, there is the diaphragm is there. Okay, just remember that is the thoraco-abdominal diaphragm, or just diaphragm we used to call, that is the diaphragm. So due to that, this diaphragm that forms the partition between the abdominal cavity and the thoracic cavity. Forms the partition between the thoracic cavity. So this diaphragm form the partition. Now here I will show you in the rough diagram here. Now see here. Suppose here is your neck, okay. For your understanding only I am making this thing. So now here is your thoracic cavity, suppose. Okay, it is the truncated cone. Okay, for your understanding only I am making this. Okay. Now here is your, suppose here is your, now abdominal cavity is below. Okay. Now, is it visible to you, this picture?
Yes,
Is it
sir.
visible? Huh?
Yes, sir.
Okay.
Yes, sir.
Okay. For your understanding, I am making this simple diagram. Okay. Now see. Okay. This is not there. Okay. Now this is also not here. Okay. Now see. Suppose this is the neck. Okay. So this is for the, just for understanding. Just I will write here neck. N for neck. N for neck. Okay. This is, suppose this is the neck. Okay. If you need head, I will also draw that head also. Suppose this is your head. Head is here somewhere. Okay, this is head, suppose. Okay. Now this is neck. So this is the thoracic cavity here. So this is thoracic cavity, T for thoracic cavity, and this is the abdominal cavity. Okay. Now see this is a truncated cone shape. Okay, this is the thoracic cavity. Now see, if you see here, so this is the thoracic inlet, and next is the thoracic outlet. Okay. Now see in the thoracic inlet, so the thoracic inlet that is not in large shape. Okay, so it is guarded by the diaphragm is there. Okay, that diaphragm makes the thoracic inlet small. So they are in two half. So one half of the diaphragm, next half of the diaphragm. Okay. So these two are the substance fascia, suprapleural membrane. So that two half is there, and in between the two half there is the thin slit like communication between the neck and the thoracic cavity. Okay, are you getting? So next see, in the lower part, you will see the next diaphragm here. So this diaphragm is not straight here. So this diaphragm, rather it is like this. From the dome. Okay, so this diaphragm, this thoraco-abdominal diaphragm, it bulges towards the thoracic cavity. Okay. Let it make more good picture. Okay, suppose. So one dome. Actually, it has got a two dome, so I am making this. Okay, so it is, see, it is not straight. This diagram is not straight and flat. So it forms the bulging towards the thoracic cavity. So now see, due to this nature, see the thoracic cavity, see, lower end is wider, upper end is narrow, isn't it? The cavity, if you see the cavity, lower part of the cavity is slightly wider, upper part is narrower. So see, again, this diaphragm, see, it is bulging towards the thoracic cavity, isn't it? And this bulging of the diaphragm in the thoracic cavity also reduces the thoracic cavity, size of the thoracic cavity, isn't it? So from outside, see, thoracic cavity look larger, isn't it? But actually the thoracic cavity is smaller. Okay, due to this only, see, due to the bulging of the diaphragm into the thoracic cavity. Okay, then what will happen? It is increasing the abdominal cavity, isn't it? So the abdominal cavity increases. Okay, so this thoracic case, in the lower part of the thoracic cage, you will find the extension of the abdominal cavity here. So due to the bulging of the diaphragm towards the thoracic cavity, the abdominal cavity extends in the lower part of the thorax. So that the cavity in the thorax, it is smaller. Okay, that makes it smaller, and the next structure that makes the thoracic cavity smaller, see, due to its shape. See, it is not. So see, we are seeing the thoracic cavity, isn't it? So almost outlet of thorax, thoracic wall, and inlet of thorax, that is already over, isn't it? Now the next we will see the division of the thoracic cavity now. Okay, so the ventral body cavity, we have got a two thoracic cavity and abdominal pelvic cavity, and we are reading the thoracic cavity. So the thoracic cavity wall is over. Now again the thoracic cavity has got some divisions. Okay, it is subdivided into other cavities. Okay, so it has got a subdivision. See, basically the thoracic cavity is divided into three cavities. Okay, two pleural cavity and one mediastinum. Okay, so subdivision are three subdivision. Okay, out of these three subdivision, two pleural cavity and next one mediastinum. So totally three. Now we can see in this picture here. See in this picture, in this diagram here, you can see this purple set color here. So this is the pleural cavity. Okay, and the space between these two pleural cavity, this orange color and this greenish color. Okay, greenish bluish color. So this is space, this is the mediastinum. Okay, so we have got a three subdivision of the thoracic cavity, that is two pleural cavity and the mediastinum. So actually, see, if you see in the thoracic cavity, the most of the space of the thorax that is occupied by the pleura and the lungs. Okay, so most of the space is occupied and only minimal space is remaining between the pleura and the lungs. Okay, that minimal space, the potential space, that is the mediastinum only. Now see in the picture in the right side here. So see here, the two pleural cavity, right and left pleural cavity, they are occupied by the lungs. You can see here. So the pleural cavity, there is the lungs actually. So this is the lung. Okay, and in this side also, this is the lung. So right and left lungs. Now see in between the two pleural cavity, the remaining space is there. So this space, that is the mediastinal septum or mediastinum. Okay. So this mediastinum, the major content of the mediastinum is heart. Okay, and the other structures are also there. I will give the name of that content. Okay. So pleural cavity. So right and left. Right and left cavity. Okay, and this cavity contains the right and left lungs respectively. So this pleural cavity occupies the most of the space of thoracic cavity. Most of the space of the thoracic cavity, okay, is occupied by the pleural cavity. By the most of the space of the so this is the pleural cavity. So on the right hand, so right side and the left side, okay, there is the pleural cavity in the thoracic cavity. So it occupies the most of the space in the thoracic cavity. So the content of two pleural cavity, that is the right lungs in right pleural cavity, left lungs in the left pleural cavity. Just remember this much. Okay. Now next is the mediastinum. So the mediastinum, see, this is the midline space between the two pleural cavity. Okay, so these are the two pleural cavity, right pleural cavity, left pleural cavity, and this is the midline space between these two pleural cavity, that is the mediastinum. Okay, so between two. Okay, this cavity is very small. Okay, comparatively it is smaller than the pleural cavity. So this is the mediastinum. So if you see the content of the mediastinum, okay. So major content of this mediastinum, that is heart, pericardium and heart. Then the other content, they are the trachea, esophagus, okay. Then the bronchus, okay. principal bronchus, that is right and left principal bronchus. Bronchus. Then you will find the vagus nerve, that is right and left. Go again. Vagus nerve, phrenic nerve, right and left. Nerve, and pericardium, heart, and root of greater vessels, right? Then phrenic nerve is there. Then azygous vein, azygous vein, accessory azygous vein. Okay. Azygous, hemiazygous, accessory azygous. Okay. Then thoracic duct. Okay. Pancreas nerve. Then you will find the so who is keeping the audio on? Karthik. So these are the major content of the mediastinum. See, actually this mediastinum again it has got a subdivision. Okay, just now here, just you remember the mediastinum. So mediastinum is the next topic. Okay, that is the next topic only. Again, the mediastinum it has got a boundary and it has got a subdivision: superior mediastinum and inferior mediastinum. Again, inferior is divided into anterior, middle, and posterior, like that. So it is the next topic for the discussion. Okay, so just you remember now here the mediastinum, that is the midline space between the two lungs. Okay, here see they have given the two different colors for the superior mediastinum and the inferior mediastinum. Actually, these two both are the mediastinum only. So again divided into superior mediastinum, inferior. Inferior is again anterior, middle, and posterior, like that is here. But now just you remember the content of the mediastinum. Okay. Up to here, okay. So it is see. So they are the content of the mediastinum. Okay. Other thymus gland is also there. Okay. Then sternopericardial ligament, internal thoracic vessels, they are also there in the content. Okay, that will deal while reading the mediastinum topic. Okay, now you remember up to here. So this is the mediastinum, that is the midline space between the two pleural cavities. In the thoracic cavity, that is the mediastinum. Just remember this much, that is sufficient. And remember the content. See, pericardium and heart. Heart you know. Root of greater vessels means the vessels coming from the root and entering in the heart. Okay, coming from the heart and going to the heart. So artery will come out from the heart, vein will go inside the heart. So they are the root. Okay, that is superior vena cava, inferior vena cava, pulmonary trunk, ascending aorta, pulmonary vein. They all are the root of the greater vessels. Okay, this root of greater vessels, it will come while we will read the heart. Okay, just remember now here they are the contents. Okay, now we'll go for the next. The next ventral body cavity or larger ventral body cavity, that is the abdominopelvic cavity. Okay, so here thoracic cavity, that is over only. So next cavity, this is the larger body cavity. See, so it is the abdominopelvic cavity. So next ventral body cavity, that is the abdominopelvic cavity. You can see here, see this region. Okay, so this is the bony wall of the abdominopelvic cavity. See, you will find bone only in the upper part and the lower part. In the middle part, this middle part of this wall, that is formed by the mostly by the muscles. Okay, now we'll see what are the skeletal element in the wall of the abdominal cavity and what are the muscles in the wall of the abdominal cavity. We'll see this thing first. Okay, now for abdominal cavity, so it lies below the thoracic cavity. Okay, so it extends just below the thoracic cavity up to the pelvic floor or pelvic diaphragm. That everything we'll see here. So it is the large body cavity, largest ventral. So it is largest body cavity also. Okay, so extend below the thorax, that is actually below the diaphragm. Okay, below the thoracic thoracic cavity. Just I'll write here because there is the partition is there. Okay. Diaphragm, that is which diaphragm? That is the thoraco-abdominal diaphragm. Thoraco-abdominal diaphragm. Okay. Below the thoracic cavity, that is the thoraco-abdominal diaphragm. Okay. To the pelvic diaphragm. Okay. So just you can write this is the cavity between the thoraco-abdominal diaphragm and the pelvic diaphragm. That is okay. Okay. So now this abdominal pelvic cavity also we'll see the following heading. Okay, here. So we'll see the wall. We'll see the wall. Then we'll see the. So wall means that is anterior lateral wall, posterior wall. Okay, everything we'll see. Then roof we'll see. That means the upper limit of that abdominal pelvic cavity. Then floor we'll see. Now you can see here. See if you see in this picture here. So this is the roof. Okay. So this is the roof of the abdominal pelvic cavity, and this is the floor of abdominal pelvic cavity, and remaining portion that is the wall of the abdominal pelvic cavity. So in the wall also we'll see the anterior lateral wall, anterior lateral, posterior wall we'll see. Okay. First in wall also we'll see the skeletal element and the muscular element. Okay. Now we'll see the individual component now. So this is the abdominal cavity. Okay, that lies below the thoraco-abdominal diaphragm. Okay, up to the pelvic diaphragm. Pelvic diaphragm is here. So you can see this reddish color here. This is the pelvic diaphragm, and this is the thoraco-abdominal diaphragm. Generally we used to call diaphragm. So this cavity, this is the abdominal pelvic cavity. So see, the name only suggests that abdominal pelvic cavity. So it has got a two part. So abdominal cavity and the pelvic cavity. Okay, abdominal cavities. Now see here this reddish color, that is the abdominal cavity, and this bluish color, that is the pelvic cavity. So it has got a common name, abdominal pelvic cavity, because there is no partition between there is no division, there is no boundary. Okay, between the abdominal and pelvic cavity, because this abdominal cavity and pelvic cavity, they will communicate each other freely. There is no boundary. Okay, but in between the abdominal and the thoracic cavity, there is the boundary of diaphragm. So this diaphragm, that is the musculotendinous septum. Okay, so there is boundary, but in between the abdominal and pelvic cavity, there is no boundary. So, okay, now we'll see this thing. Abdominal cavity and okay, these are the two parts of the abdominal pelvic cavity. So abdominal cavity and pelvic cavity, that is the abdominal pelvic cavity. Now we'll see the wall. Okay. Now see, in wall also see, we'll see the some bony element in the wall, and we'll see the muscle. So actually see here, in this part, see, in the anterior part there is no bone, isn't it? So this wall is formed by the muscles only. In the lateral part also there is no bone. So this wall is formed by the muscles. So mostly the anterior and the lateral wall of the abdominal cavity, that is formed by mostly by the muscles. Okay, anterior and the lateral. And some part in the posterior also there is the muscles. Okay. In posterior midline there is the vertebra is there. But in the upper part, see, in the upper part you will find the ribs. Okay, this thoracic is okay contribute in formation of the upper part of the wall of the abdominal cavity, and in the lower part, so this abdominal wall of abdominal pelvic cavity, that is formed by this is the pelvic. Okay, bony pelvis, that is. Okay, just I will write this for you. Now see here. Now we'll see the bony element. Okay, bony wall forming the wall of abdominal pelvic cavity. Now we'll see. See, we can divide into three headings. Okay, upper part then middle part, lower part. Upper part, middle part and lower part. Okay. Here we are going to see the abdominal pelvic. So these three different reasons they have got a different bone. Okay. Now see if in the upper part you will see the ribs and the costal cartilage contributing in the formation of the abdominal wall. But in middle part you will not find more bone. Only you will find bone in the posterior part. And in the lower part, okay, you will find the bone again. Okay. Now see here in the upper part what you will find. So in the upper part see almost lower 8 ribs. Okay. And adjoining costal cartilage. Okay, that forms the wall of the abdominal pelvic cavity. In the upper part, you will find the lower 8 rib. Okay, so while lower 8 rib, see this ribs they also forms the boundary of thoracic cavity. But as while explaining the thoracic cavity, I have already mentioned you that comparatively thoracic cavity is smaller. Okay, because see here, this dome of diaphragm is this concavity of the diaphragm that is above only. See, it is like this. See, in this diagram, I will draw this diaphragm here. See, this diaphragm is not straight like this. Okay, this diaphragm is not straight. Actually, this diaphragm, see, it forms the dome. Okay, it extends almost here. Okay, right dome here up to here and the left dome slightly below here. So it forms like this. See, diaphragm will be like, okay, the concavity of diaphragm is towards the thoracic cavity. So what will happen? The thoracic cage, okay. So this portion of this thoracic cage that contribute in the formation of the abdominal cavity. So abdominal cavity extends below the protective cage or protecting covering of the thoracic cage. Up to here thoracic cavity, abdominal cavity is extending up to here. Okay, so diaphragm is not straight. Okay, so abdominal cavity extend up to here. So abdominal cavity is under the protection of thoracic cage. Upper part is under the protection of thoracic cage. So up to here. So this upper part of the abdominal pelvic cavity wall that is formed by the lower 8 rib and the adjoining costal cartilage also. Okay, so including the adjoining thoracic vertebra. Okay, just add here cartilage and thoracic, adjoining thoracic vertebra. Okay, so because the abdominal cavity is extend under the protection of this thoracic cage. Okay, so that the thoracic cavity is comparatively small. Actually, it seems larger from outside, but actually, if you see inside, that is smaller. Okay, due to extension of the abdominal cavity in the lower part of the thoracic cage. Okay, and due to this concavity of diaphragm above or concavity of the diaphragm towards the thoracic cavity. Okay, just remember this thing. So in the middle part, see only the bony element you will find in the posterior part. See, in the posterior part only there is the bone, but in the anterior and lateral there is no bony element. So in the middle part, the skeletal element you will find in the middle part, that is the lumbar vertebra. Okay, so adjoining intervertebral disc. Okay, so see here, this is the lumbar vertebra. On the posterior part only, see, these are the lumbar vertebra. 5 lumbar vertebra are there, and in between the lumbar vertebra there is the intervertebral disc. This bleach color, that is the piece of fibrocartilage, that is the intervertebral disc. Okay, so the lumbar vertebra and the adjoining intervertebral disc on the with posterior midline. Okay, in the middle portion there is the skeletal element only in the posterior aspect in the midline only. Okay, just remember that is the middle part. Now, if you see in the lower part, so in the lower part you will find the bone all around. Okay, so this lower part, the skeletal element forming the wall of abdominal pelvic cavity is the bony pelvis. Bony. So bony pelvis. See this whole structure that is the bony pelvis. So this bony pelvis, see posteriorly that is formed by the sacrum and coccyx, and on the either side and in the front that is formed by the two hip bone. So right hip bone and this is the left hip bone. Okay, so this bony pelvis that forms the lower part wall of the skeletal wall of the lower part of the abdominal pelvic cavity. So bony pelvis that is going to form. So bony pelvis that consists of the sacrum and coccyx, posteriorly and right and left hip bone on either side. So see, these are the hip bone. So this large bone, this is the hip bone. This is the irregular bone only. So this is the hip bone. Okay, that is the bone of pelvic girdle. Okay, so this is the hip bone, two hip bone. This one hip bone, two hip bone, and posteriorly this is the sacrum, and this is the tailbone, that is the coccyx. Okay, so that is the lower part. So they are the skeletal element in the abdominal pelvic cavity. Now we'll see the muscular element. Okay. Okay, up to here, the bony component forming the or skeletal component forming the abdominal pelvic wall, that is okay. So in the upper part, so there is the contribution of the lower part of the thoracic cage. Okay, in the middle part you will find the lumbar vertebra only in the posterior midline, and in the lower part that is the bony pelvis. Okay, thus you remember these 3 points. Okay, so upper part there is the lower part of thoracic cage. Middle part there is the lumbar vertebra. Lumbar vertebra on posterior midline. So how many lumbar vertebra is there? There are 5. Okay. So in bracket I will write 5 lumbar vertebra. Okay. Adjoining and also. Okay. In an intervertebral disc also you have to write. So this piece of cartilage is intervertebral disc. In the middle is this, and in the lower. So easy to remember. Okay. Bony pelvis. Okay. Upper. So just you remember this point. Okay. So these are the skeletal elements. Now we'll see the muscular element. Now see the muscular element now. Now they are the bone. Now see, there is the contribution of the muscles also forming the abdominal pelvic wall. Now see what are the muscles they contribute in formation of the abdominal pelvic wall. Okay, now the muscular contribution. So this muscular contribution we can read under the 2 headings. That is in anterior lateral aspect we will find the different group of muscles. In the posterior wall we will find the different muscles. Okay, so muscular element you will see. Abdominal pelvic wall. So again we will see in the anterior lateral, anterior lateral wall and posterior. Okay. So now we are going to see the muscles. What are the muscles present in the wall? Okay, so we'll see the muscles in the anterior lateral part, and we'll see the muscles in the posterior part of the abdominal pelvic wall. Now see here. See, these are all the muscles of anterior lateral abdominal wall. Okay, so this anterior lateral abdominal wall consist of the muscles. So the major muscles, they are the external oblique, internal oblique, transversus abdominis, and the rectus abdominis. Okay, just you write the name. Okay, external oblique. So internal oblique, transverse abdominis, okay, or transversus abdominis, then rectus abdominis, and even you will see in the lower part pyramidalis. Okay, that is small muscles only, pyramid in shape, pyramidalis. Okay, so just you remember this point. Okay, so they are the muscles in the anterior lateral abdominal wall. Now I saw these muscles in this picture. Now see here. So this is the external oblique. Okay, the outer layer of the muscle. So they actually these muscles, they are in layer. So external oblique one layer. If you cut and open, you will find the internal oblique. If you cut and open, you will find the transverse abdominis like this. Okay, so they are in 3 layers. Okay, so outside you will find the external oblique. As you cut the external oblique, you will see the internal oblique. See, this is the cut. We have cut and seen. So after cutting the internal oblique, again you will see the transverse abdominis. Okay. Now one more muscle is there in the anterior midline. So this muscle, that is this muscle. So this is the rectus abdominis. Okay. So it will be in both sides. Okay. In right side also, left side also. Okay. So these are the muscles, and one more small muscles will be in the lower part only. So in the pyramid shape, that is the pyramidalis. Okay, it is not shown here. So that is also the small muscle, pyramid in shape. So pyramidalis. So this is the muscular element in the anterior lateral wall. Now we'll see the muscles in the posterior wall. Okay. Okay, up to here. Are you getting up to here?
Yes, sir.
Huh?
Yes, sir.
Okay. Now see posterior wall. Now we'll see the muscles in the posterior wall. Okay. Anterior lateral wall, they are the muscles. External oblique, internal oblique, transversus abdominis, rectus abdominis, and pyramidalis. Okay, that is the muscles in the anterior lateral abdominal wall. Now the muscles in the posterior abdominal wall. So it has got a, see, you can see here muscle. See here you can see this one muscle here, one muscle is here, one muscle is here, one muscle is here. So they are the psoas minor, psoas major. This is the quadratus lumbarum, and this is the iliacus muscle. Okay, the name of these muscles we are going to write: psoas minor, psoas major, iliacus. Sorry, this is quadratus lumbarum, and then this is the iliacus. Okay, just you remember the name. So the muscles, they are psoas major, psoas minor, quadratus lumbarum. So this is the quadratus lumbarum because it has got a quadrilateral shape. So it is the quadratus lumbarum. This is also the quadratus lumbarum. So in both sides, okay. These muscles will be in both sides. I am explaining in one half. So they will be in the next half also same. Psoas minor, psoas major, quadratus lumbarum, and iliacus. Quadratus lumbarum and iliacus. So these are the muscles in the posterior abdominal wall. So they are the muscular element. Okay. Now what we read up to now, see here. Up to now we read wall, isn't it? Roof and floor is remain. Okay, in wall what we have read? So wall, so we have seen the skeletal component of the wall and the muscular component of the abdominal pelvic wall, isn't it? So skeletal element, upper part, middle part, lower part, we have divided and we have, okay, upper part there was the lower part of the thoracic cage, middle part there was the lumbar vertebra in the posterior midline, in the lower part there was the bony pelvis, that is the skeletal component. Muscular component, anterior lateral wall and the posterior wall. Okay, that up to there we have already completed. Now we'll go for the roof and the floor. Okay, up to here we have read muscular component, we have read. Now next we'll go for the now see, we'll go for the roof of the abdominal pelvic cavity. Okay, wall is completed. Now roof. Now see, if you see the roof, see here. See, this forms the roof. The dome of the thoraco-abdominal diaphragm, that forms the roof. Okay. Now see in this picture here. So this is the thoracic cavity above. This is the abdominal pelvic cavity. Now see here. Can you see this portion? This portion. Here you can see this portion. So this is the dome of diaphragm. So this dome of thoraco-abdominal diaphragm, that forms the roof. A roof is like dome shape. So the convexity of the roof is directed towards the thoracic cavity. Okay. So see here, this is the roof. Okay. Below is the abdominal cavity. So that is the roof. So roof is formed by the dome of thoraco-abdominal diaphragm. Dome of so generally thoraco-abdominal diaphragm we used to call diaphragm only, okay? Diaphragm. So if you see the extension of this roof, okay, this dome is extended upward into the thoracic cavity, okay? The dome is extended towards the thoracic cavity only. See, actually see it has got a two dome, right dome and the left dome, okay? So diaphragm, it has got a right dome and left dome. So that if you see the extension of right dome, it extends up to the level of fourth intercostal space, right fourth intercostal space, whereas the left dome, that is slightly lower than the right dome, so it lies at the left fifth intercostal. Okay, so right dome is higher than the left dome. See, you can see in this picture also direct. See, this is the right dome is above and left dome is slightly below. Okay, so right dome lies at the fourth intercostal space, whereas the left dome lies at the fifth intercostal space on the left side. This lies on the right side. Okay, thus you remember. So due to this dome of this roof, the thoracic, this abdominal cavity is extended under the protection of the thoracic cage. Okay. Due to this convexity or dome, convexity of the diaphragm towards the thoracic cavity, the abdominal cavity extend below the protection of the lower part of thoracic cage or costal element. Okay, so up to here now it is the abdominal cavity. See, it is the dome. So up to here that is the abdominal cavity. So it is under the protection of the ribs and costal cartilage, isn't it? So due to that only the abdominal cavity extends up to the lower part of the thoracic cage. So the thoracic cavity is comparatively it is the smaller cavity. Okay, but actually if you see from outside, see up to here it is there. But if you see inside, up to here only. Okay, thoracic cavity. Because of extension of abdominal cavity. Okay. This is about the roof. Okay, so the roof forms the partition between the partition between the partition between the thoracic and abdominal cavity. So that partition, that is roof, and that roof is the diaphragm. The diaphragm forms the partition. So it is the wall between the thoracic cavity and the abdominal cavity. So it separates these two cavities. Just you remember this thing. So this is the roof of the abdominal pelvic cavity. Then the next is the floor now. Okay, we have seen the roof. We have seen, now we have to see the floor, the lower part of the trunk, abdominal pelvic cavity. Upper part, that is the roof, and around is the wall. Now we'll see the floor. What is there in the floor? We'll see. So the floor, that is formed by the pelvic diaphragm. Okay. So there are two muscles you will see here basically. Okay. So these two muscles, they are the levator ani and the coccygeus. Okay. So the floor, that is the base of the trunk, or that is the lower part of the abdominal pelvic cavity. The floor that forms the lower part of the abdominal pelvic cavity, and that is formed by the pelvic diaphragm. See, this is the floor only. Okay, so floor that forms the lower part of the, just I will write it, abdominopelvic cavity. So that is formed by the floor that is formed by the pelvic diaphragm, so this is the pelvic diaphragm only. Okay, this part is the pelvic diaphragm. Okay, that is the base. Okay, so if you see the muscles in the pelvic diaphragm, you will find the two sets of muscle here. They are the coccygeus and the levator ani. Okay, coccygeus and levator ani and the coccygeus. Now you can see here this muscle here. See in this picture here. See this beside the. See, this is the front side. This is the back side. So here this is the sacrum and coccyx. Okay. So see here on the back side you will find one set of muscles on the either side, that is the coccygeus, and remaining this all, the red color, this blue color, green color, they all are the levator ani only. So this levator ani, again, it has got a various part. Okay, so iliococcygeus, pubococcygeus, puborectalis. Okay, various parts are there. Just you remember now levator ani. So these all muscles, that is, so floor, that is formed by the pelvic diaphragm. So here you can see the pelvic diaphragm here. Okay, in the pelvic diaphragm, basically the two sets of muscles that forms the pelvic diaphragm. Okay, these two sets of muscles, they are the levator ani and the coccygeus. Okay, name I have already written for you. So here, see, you can see here also. So these muscles on the posterior sides, this is the coccygeus muscles. This is the coccygeus. Okay, this muscle, not this muscle, this muscle. Okay, I will highlight here. Okay. So I will highlight with the green color for the coccygeus muscle. Okay. Now see here. So in this muscle, see this muscle. This is the coccygeus muscle. Can you see this triangular shape here? So this is the coccygeus muscle. Okay. Are you getting? So the next muscles, that is the, I will highlight with the different color here. Suppose blue color I will highlight here. Now the next set of muscles, these all muscles. So these are all muscles, they are the levator ani. Okay, are you getting? So this is the
Yes,
levator
sir.
ani.
Yes,
So on the
sir.
both side, okay, on the right and the left, both side. Okay, two sets are there. All are in pair only, right and left. Okay, so these are the levator ani. Okay, now see, one more muscle is there contributing in the formation here. See, can you see in the back side this muscle here? So I will highlight with a different color for that muscles. Let me highlight with the some red color. Okay. So here this muscle here in this back side. So this, Okay, these muscles also help in contribution of the wall. So, but this is not the pelvic diaphragm. Okay, so pelvic diaphragm is formed by these two sets of muscle only. And see, there is the contribution by one more muscle, that is the piriformis. Piriformis. So this is the piriformis muscle. Okay. Okay, up to here. So that forms here the pelvic floor, or the floor of the abdominopelvic cavity. Okay, up to here. Okay.
Yes, sir.
Okay. Now see this at just be so just a, that is the suppose see here. Suppose this is the pelvic diaphragm. Okay, or the floor. So just above the floor, that is the what is there? That is the abdominal cavity or abdominopelvic cavity, isn't it? And if you see below the this pelvic diaphragm, there is the perineum. Okay, perineum. Okay, that lies just below the pelvic diaphragm. That perineum consists of the external genitalia of male and female. Okay, and this perineum actually that is the region between the two thigh. Okay, between the two thigh. So that is the perineum. So that lies below the pelvic diaphragm. Okay, so that pelvic diaphragm is the boundary between the perineum and the pelvic cavity, that is the abdominal pelvic cavity. We are dealing the abdominal pelvic cavity. Again, abdominal cavity is abdominal and pelvic. So pelvic diaphragm is the partition between the boundary between the pelvic cavity and the perineum. Okay, just you remember, or I have to write that also. So just below the pelvic diaphragm there is the perineum. Perineum. So this perineum. So this is the region between the thigh. Okay. So it lies below the pelvic diaphragm, and it contains the external genitalia. So external genitalia, vulva in case of female, and scrotum and penis in case of male. Okay, just remember this thing. So this is in the perineum. Okay, no need to write this thing in the floor. Okay, just I have given the idea about the perineum here. Okay, below the pelvic diaphragm, that is the perineum. Okay, okay. Now we will see the. Okay, now floor is okay, roof is okay, wall is okay. Then we will see the some division here. Okay, now see this abdominal pelvic cavity. It is divided into two. Okay, that is the abdominal and pelvic. Okay, now we will see the division here. Okay, now division. So abdominal cavity divided into two. So that is abdominal and pelvic cavities. So this pelvic cavity again divided into two: greater or false and lesser or true. Lesser or true. Here. True pelvis. Okay. So I'll give one here. I'll give two. Okay. So see here. Actually, see, I have written the two division, abdominal and the pelvic cavity. Actually, see this abdominal cavity. See this pelvic cavity. There is the greater pelvis, isn't it? So this greater pelvis, it will come under the abdominal cavity only. Okay. Remember this thing here. Okay. So the abdominal cavity here, it contains the greater or false pelvis also here. Okay, just I will write here also. Okay, then I will tell here greater or false pelvis. So if pelvic cavity means, generally we will consider the true pelvis only, that is the pelvic cavity. Okay, this greater pelvis will consider under the abdominal cavity. Okay, are you getting? Hello, are you listening?
Yes, sir.
So,
Yes,
see,
sir.
division is abdominal and pelvic cavity. Okay. Pelvic cavity means generally we will consider the lesser pelvis as the pelvic cavity. Okay. Okay. So this greater pelvis that will be the part of the abdominal cavity only. Okay. Now see here. I'll show you here this thing. Now see here. Can you see here? So this is the which section? Coronal section. Okay. Now see here. From here. So this is the this whole thing. Whole thing is the pelvic cavity only. Okay. Now this pelvic cavity is again divided into two. Greater pelvis or the major pelvis. That next name for the major pelvis or greater pelvis is false pelvis. And the lower part of the pelvis, that is the true pelvis or the lesser pelvis. Okay, now see here this red part, that is continuation with this above red part. So this is the abdominal cavity. So this greater pelvis, that is the part of abdominal cavity only. If you say the abdominal cavity means abdominal cavity plus greater pelvis. Okay, pelvic cavity generally will consider only the true pelvis. Okay, are you getting up here?
Yes, sir.
Okay, so just remember this thing now. So two division, abdominal cavity that include the greater pelvis. Okay, and the next is the pelvic cavity, that is only the true pelvis. Okay, so these are the two division. Okay, so how this abdominal cavity, that is the above cavity and the lower cavity is divided. What is the boundary? We'll see now. So this boundary between this abdominal cavity and the true pelvic cavity is formed by the pelvic brim. Okay. So I will write that thing for you. So abdominal cavity is there. So next is the true or lesser pelvis. Lesser pelvis is there. Now in between these two there should be some boundary, isn't it? So that boundary between these two cavity is formed by the pelvic brim. Pelvic brim or pelvic inlet. So this forms the boundary between the abdominal cavity and the true pelvis. So this is the true pelvis. Now greater pelvis, that is the part of abdominal cavity only. So I am writing the here true pelvis. So this is the boundary here. Now how this boundary is formed? See here in this picture here. So this red circle you can see in this right hand side picture here. So this is the boundary only. Actually, see this is the boundary. Now see here in the boundary. So this pelvic brim, how it is formed? So posteriorly, see, posteriorly there is the body of S1 vertebra. So the anterior prominent margin of the body of S1 vertebra, that is the sacral promontory. So the sacral promontory in the posterior side, posteriorly there is the sacral promontory. Sacral promontory. Then on the either side, and then in the front side, anteriorly. Now we'll see here. So posteriorly, okay. So this is the body of S1 vertebra. Okay, the anterior prominent margin of the body of S1 vertebra has got a name, that is the sacral promontory. So posteriorly there is the sacral promontory. Now on the either side, see this side and this side. Okay. So this side and this side. So this side and this side, okay, that is the lateral side. Two lateral side, the boundary is formed by the linea terminalis. Okay, linea terminalis. So this line. So up to here, this is the sacral. Just I will highlight here. Okay. So I will highlight the sacral promontory with green color. Okay. So this part is the sacral promontory. Okay. Now next I will highlight with some different color. Let me highlight with the blue color. This portion of this pelvic brim. Okay. This bluish color of this pelvic brim. Okay, it has got a different name. Now anteriorly I will highlight with some red color. Okay, this color I will highlight here. So this part. Okay, now see, can you see this different three region here? So posteriorly, that is the sacral promontory, and on the either side, see this bluish color. So that is the on the either side. That is by the linea terminalis or linea terminalis. Linea terminalis. So actually, this linea terminalis, this consists of ala of sacrum, arcuate line, and pubic crest. Okay, now I will tell this thing also. So this is on the either side. So either side, that is by the linea terminalis. So this linea terminalis, it has got a different part, ala of sacrum, arcuate line, and the pubic crest. Now I saw this thing by the black color, okay, or pinkish color. Okay, now see here. So this whole, this bluish shade, okay, bluish line, this is the linea terminalis. Okay, now this linea terminalis, it again has got some part. See, from sacral promontory up to here. Okay, so this is the ala. Actually, this part, this wing-like structure, this is the ala of sacrum. So up to here, this is the ala of sacrum, and from here to, let me highlight with a different color here, again green color, let me take. So from here to here, okay, so this is the arcuate line, okay. Then the next, anteriorly, from here to here, different name. Now see here, so the posterior, this whole thing is the linea terminalis or linea terminalis. Okay, the posterior most part, this is the ala of sacrum. So this portion, okay, up to the pubic tubercle. So this is the actually the lower part of the medial border of the ilium. Okay, ilium has got a three border: anterior border, medial border, and the posterior border. If you see the medial border, it has got a two part again. So sacral part and the pelvic part. So this pelvic part of the medial border of the ilium, so that is the arcuate line. Okay, then here is the pubic tubercle. From pubic tubercle to the pubic symphysis, this prominent margin, so this is the pubic crest. So this all three things, that is the linea terminalis. Okay, up to here. Now anteriorly, see, anteriorly this orange color, so this is the pubic symphysis. So the anterior part of the pelvic rim is formed by the pubic symphysis. Right here. So this is the, let me write with the red color, pubic symphysis. Pubic symphysis. Okay, so here you will see this thin piece of cartilage here. So this is the pubic symphysis. Okay, are you getting up to here? Okay, any confusion up to here? So this is the boundary between the abdominal cavity and the true pelvic cavity. Just you have to remember this thing. So this may be a viva question. Okay, in bony pelvis you have to show this brim. Okay, so sacral promontory, ala of sacrum, arcuate line, that is the lower part of the medial border of the ilium. Okay, then the anteriorly there is the pubic crest. So this pubic crest has got another name also, pubic crest, pectin pubis. Okay, different name are there. So just you remember the pubic crest. Okay, then this is the pubic symphysis. Okay, up to here.
Yes, sir.
Okay, so linea terminalis. Okay, linea terminalis. So linea terminalis, three parts are there. Ala is there, arcuate line is there, and the pubic crest is there. Just remember this thing now. Now, so this is the general division of the pelvic cavity, abdominal pelvic cavity. Okay, abdominal cavity and true pelvic cavity, two division. Because the greater pelvic cavity or false pelvis, it will be the part of abdominal cavity only. So two division, abdominal cavity and true pelvic cavity, two division of the abdominal pelvic cavity. So this is the demarcation between these two. But actually they will communicate with each other. Okay, there is no wall is there, only boundary is there, margin is there. Okay. So let me go forward. Now see here. So we have got some plane. Okay. We have got some imaginary plane. Okay. We are going to use. Okay. To estimate the structures of the abdominal cavity. Okay. Some guideline we need. Okay. For that guideline we need some imaginary plane. Okay. So with that help of imaginary plane we can locate the various structures of the abdominal cavity. So okay, these are some guidelines or some imaginary plane we are going to read in the abdominal cavity. Now see here first, that is the external plane. So this is the external plane. This is the plane that is again the imaginary plane. This is the transverse imaginary plane passes along the external joint. Okay. So see, these all are the imaginary only. Okay. There is no plane in the body. Okay. So transverse imaginary plane. So that passes okay along the external joint. So see, sternum has got a three part: manubrium, sternal body, and the xiphoid process. Okay, the joint between the sternal body and the xiphoid process, that is the sternal joint. So that is the imaginary plane at the level of sternal joint. Okay. Okay. Okay.
Okay.
Let me show you this sternum in diagram. Okay, we'll see this thing here. Okay. Full screen. Okay, see here. So can you see here? So this is the sternum. Okay, part of sternum is here. Body of sternum is here. This is the xiphoid process. Okay, this junction between these two parts, body of sternum and xiphoid process, this is the sternal joint. So this your sternal plane, it passes along this plane. Okay, so suppose this is the sternal plane. So this passes along the sternal joint. Okay, are you getting? Okay.
Okay, sir.
One more plane is there. Okay. So just see here. So this is the sternal joint. Now next plane we will see, and we will again see in the diagram. Now the next plane. So we have got a next additions plane or the transpyloric plane. So actually see this transpyloric plane. This transpyloric plane actually, see, first you should know this nodes. So this is the suprasternal nodes or jugular nodes. Okay, this point you have to know. And next is the pubic symphysis. Initially you have seen the pubic symphysis, isn't it? Isn't it in the previous diagram? So that is the pubic symphysis. See, if you take the midpoint between this jugular notch and the pubic symphysis, okay, thus take the midpoint between this. So this plane passes along that midpoint. So this transpyloric plane, that is the imaginary plane that passes along the midpoint between the jugular notch and or that lies midway between the jugular notch or supraesternal notch and the pubic symphysis. Okay, I'll write here for you. So this is the imaginary only. Okay, all are imaginary only. Transverse and imaginary plane. Okay, passes midway between the supraesternal notch or jugular notch, jugular or sternal notch and pubic symphysis. So this is the additions plane or transpyloric plane. Okay, for this we also can write, see this is the imaginary transverse plane that passes along the tip of 9 costal cartilage. So also we can write this point, see it passes, so transverse imaginary plane, okay, so it passes, okay, at the tip of 9 costal cartilage anteriorly and at the lower border of body of L1 vertebra. So you can write this in this two way. Okay, so this is the transpyloric plane. So this transpyloric is actually this pylorus, that is the part of stomach only. Okay, there is the pylorus part of the stomach, and transpyloric means it is going to transverse that plane. So it passes along the pylorus part of the stomach. So it is the transpyloric actually. So see, it has got the next name Addison's plane. So you can write the description of this transpyloric plane by any means. See, either you can write it midway between the jugular notch and the pubic symphysis, or it passes along the tip of 9 costal cartilage anteriorly and posteriorly on the lower border of the body of L1 vertebra. That is the first lumbar vertebra, L1 means. Okay. So this is the transpyloric plane. So the next is the subcostal plane. So it is again the imaginary transverse plane. Okay. So it passes below the costal margin, just below the lower border of the costal margin. Okay. So transverse imaginary plane which passes along the lower limit of costal margin anteriorly and body of or upper border of body of L3 vertebra. Upper border of body of L3 vertebra. So that is the subcostal plane. Okay. After explaining, also in the diagram. Okay. So next is the umbilical plane. So umbilical, it is again the transverse imaginary plane only. Okay. So passes at the level of umbilicus. You know the umbilicus, isn't it? So it lies at this level only. Anteriorly and posteriorly it touches the vertebra between interval between L3 and L4. And posteriorly interval between body of L3 and L4. So this is the umbilical plane. Thus you have to know this plane, okay? So it passes at the level of umbilicus anteriorly. Yes?
Sir, we have another class, sir.
Okay, tomorrow we'll continue then. Okay, so just you remember this plane up to umbilical plane. Next name is the transumbilical plane. Okay, so it lies in between the L3 and L4 vertebra posteriorly, anteriorly at the level of umbilicus anteriorly. So subcostal plane just below the costal margin, anteriorly and posteriorly, upper border of L3 vertebra. Okay. And the additions are transpyloric plane at the tip of 9 costal cartilage anteriorly and the posteriorly lower border of L1 vertebra. This external plane, it passes along the external joint. Okay. Thank you, class.
Okay, sir.
Thank you, sir.
Thank you, sir.
Sir.
Thank you, sir.
See, we are reading the planes used to estimate the abdominal structure. Okay, we are reading some imaginary plane. Okay, that is required while reading the abdominopelvic cavity. Okay, this plane we are reading. Okay, almost I think this external plane and additional plane, or that is transpyloric plane, that is already over, I think, isn't it? So what is the external plane? So that is the transverse horizontal plane that passes along the level of the external joint. Okay. Then additions are transpyloric plane. So this only name only suggests, see here, transpyloric plane. So it traverses the pylorus part of stomach, means it passes along that pylorus part of the stomach. So it is the transpyloric actually. So this plane, see, it passes along the tip of 9 costal cartilage anteriorly, and as it passes posteriorly, it cuts the lower border of body of L1 vertebra. Okay, so that is the transpyloric plane. Okay, that is also already over. Now next is the subcostal plane. So name only suggests, see, subcostal plane. So actually this costal margin is formed by the costal cartilage of 7, 8, 9, 10 ribs. Okay, so that forms the costal margin. Okay, so this plane just passes from the lower border of the costal margin. Okay, in the anterior aspect, and the posteriorly it cuts the body of L3 vertebra. Okay, that is the subcostal plane. Sub means just below. Okay, just below. So that is the lower margin of the costal. Okay, lower margin of the costal margin. That is the lower border of the costal margin. Okay, from there it will pass and cut the body of L3 vertebra. So that is the subcostal plane. Okay, are you getting? Or I have to write? So all plane are imaginary only. Transverse, horizontal plane. Okay, so this is imaginary only. So imaginary transverse horizontal plane. So that passes along the lower border of coastal, or lower limit of coastal margin. Okay, better say lower limit. Okay, lower limit of coastal margin, that is anteriorly and posteriorly at the level of body of third lumbar vertebra, that is L3. Okay, so that is your subcostal plane. Now next plane, that is the transumbilical or umbilical plane. See, name only suggests. So this plane, it traverses along the level of umbilicus. So umbilicus, you know that. So in the anterior abdominal wall, so you will see one depression. Okay, so that is the umbilicus. So that is the point of attachment of umbilical cord in anterior abdominal wall of fetus. So that is the point of attachment of the umbilical cord. Okay, when you are in the intrauterine life. Okay, so from that level, so that is the transumbilical plane. So anteriorly at the level of umbilicus, and the posteriorly, so it lies in the interval between L3 and L4 vertebra. Okay, so that is the umbilical plane. So anteriorly along the umbilicus, and the posteriorly at the interval between L3 and L4 vertebra. So just between the body of two vertebrae, it is cut in the posterior aspect, whereas in the anterior aspect it lies at the level of umbilicus. Okay, so umbilicus, that is the point of attachment of the umbilical cord. Okay, you can see in the anterior abdominal wall one the depressed part, so that is the umbilicus only. So next is the supracrestal plane. So supracrestal plane. Okay, see, crest is there. So see, if you see the hip bone, okay, so this hip bone has got a upper part. Okay, so this upper border of the hip bone, so that is the crest-like structure. Okay, in the ilium, that is the crest-like. So that extends between the anterior superior iliac spine to the posterior superior iliac spine. Okay, just wait here. I have got one diagram here. Okay. Okay. See in this diagram here. So this is the pelvis only. Okay. Now see here. See. So this is the hip bone. Okay. So this whole thing is the bony pelvis. Okay. Now see in the individual hip bone. So this is the hip bone. One hip bone in this side, one in this side. So it has got a three part. Ilium. So this is the wide upper part is the ilium. So this is the pubic bone, and next is the ischium bone. Okay, now we are not going for individual bone. Now see here. So this portion, see in the upper wider part of the ilium. Okay, see this upper portion. So extending between the anterior superior iliac spine to the posterior superior iliac spine. So this portion, this is the iliac crest. Okay, so this iliac crest. So supracrestal plane means just passes along the upper part of this or the highest point of the iliac crest. Okay, so this is the iliac crest is here. So this is the iliac crest. So just above the highest point of the iliac crest. So that plane passes. Okay, almost like this. See here, I will draw here. So suppose this is the highest point of the iliac crest. Okay, from here to highest point of the iliac crest of the next hip bone. So this is the supracrestal plane. Are you getting? Are you there? So this is the iliac crest.
Yes, sir.
So this is the iliac crest. So while standing in the ground and you are going to keep your hand in the waist, no? You are keeping in the this part only. In the above the iliac crest only you are keeping your hand. Like this you are going to keep, no? Like this. So your hand will be in the iliac crest. So this portion of the bone. Okay, you will feel this part of the bone. Okay, so you are going to draw the one imaginary horizontal plane at the level of highest point of the iliac crest. So highest point is almost here. So at this level you are going to draw one plane, imaginary plane, that is the supracrestal plane. So it lies at the highest point of the iliac crest and posteriorly it got at the level of which vertebra? See here, L4 vertebra, isn't it? So that is the supracrestal plane. Are you getting?
Yes,
there?
sir.
Yes, sir.
Okay.
Yes, sir.
And then next one more plane is there. This is the next plane. Okay. Now see, supracrestal means that is the imaginary horizontal plane. Okay. That passes along the highest point of the iliac crest and posteriorly it got at the level of L4 vertebra. Okay. You can write now, or shall I write? So anteriorly that is the highest point of iliac crest. Iliac crest and posteriorly at the level of body of L4 vertebra. So that is your supracrestal plane. Are you getting? Are you getting? So now see,
Yes, sir.
what is the importance of this plane? Now see here. So while doing the lumbar puncture, okay. So this plane will be the guideline for the lumbar puncture. Okay. So see. Lumbar puncture. Now see what is lumbar puncture. Now see here. So lumbar puncture, see this is the vertebra, isn't it? So see, just behind the vertebral body there is the canal. Vertebral canal is there, isn't it? You know, no, this thing while reading the body cavity. So vertebral canal is there. So within the vertebral canal there is the spinal cord and the spinal meninges, isn't it? So see here. So while doing the lumbar puncture means see here, in certain disease, like for example meningitis, Okay, so in this meningitis, so you are going to do the analysis of the CSF fluid, cerebrospinal fluid examination you have to do. Okay, now this lumbar puncture is the method by which you are going to take out the cerebrospinal fluid. Okay, now see how this plane will helpful. See, first you will feel the supracrustal plane. Okay, and you will draw the horizontal line. Okay, so this horizontal line, see, just you will draw in the body also, you will draw outline. Okay, so almost see in the back side it lies at the level of L4 vertebra. Okay, so you can feel the now L4 vertebra with the help of this guideline. So after feeling the L4 vertebra, you will come slightly below. Then next vertebra you will feel that is the L5 vertebra. So now you are going to do the lumbar puncture in between the L4 and L5 vertebra. See, at the L4 level you cannot insert the needle, isn't it? Because there is the bone is there. Just below also there is bone, but in between this, see here, there is the cartilage is there. Okay, through this level you can insert the needle there. Okay, from the back side I'm telling. Okay, so from interval between the L4 and L5 you are going to insert the lumbar puncture needle and you will take out the cerebrospinal fluid for the analysis of the disease. Okay, so the process of the removal of CSF, okay, that is the lumbar puncture. The method is lumbar puncture because that is the lumbar vertebra only. So interval between, either you have to insert the needle in between L4 or L5 or L3 and L4, because see here, generally your spinal cord, okay, so spinal cord terminate at the level of L1, L2. Okay, so below the level of L2 that will be the safe. Okay, if you insert the needle also you will not injure the spinal cord. Okay, are you getting? So this supracrustal plane will be the guideline for the doctor for doing the lumbar puncture. Okay, so just remember this point. So this is the next plane. See, now what is the name of this plane? See, this is the iliac crest. This whole thing is the iliac crest, upper free margin of the ilium. So this is the iliac crest extending between the anterior superior iliac spine to the posterior superior iliac spine. So this whole thing is the iliac crest. Now see, to draw this plane, see, first you have to feel the anterior superior iliac spine. So you can feel this spine in the anterior part. Okay, so just keep your hand in the waist and feel the iliac crest and come in the anterior end of the iliac crest. So that will be your anterior superior iliac spine. So see, while keeping the hand you will feel this part. So from here you slide your finger forward. So you can feel the now anterior superior iliac spine. Now from anterior superior iliac spine almost 5 centimeters behind there will be the bony tubercle. So this is the iliac tubercle. Okay, so this portion is the iliac tubercle. Are you getting? So now this plane, see, so this plane passes at the level of iliac tubercle. Okay, extend between the iliac tubercle anteriorly and it cuts at the level of L5 vertebra posteriorly. So transpyloric plane, transtubercular plane, it passes anteriorly at the level of iliac tubercle. So next plane is the transtubercular or intertubercular plane. So that means, so this plane, this is again imaginary horizontal plane. So anteriorly it passes along the iliac tubercle. Anteriorly it passes along the iliac. So that is the bony nodule. Okay, just 5 centimeters behind the anterior superior iliac spine. So this is the iliac tubercle, region of iliac tubercle in the both sides. So this plane passes along these two tubercles. So this is the intertubercular plane or transtubercular plane. Okay, so anteriorly iliac tubercle, posteriorly it got at the level of so it got at the level of body of L5 vertebra. So just remember, so that is the transtubercular plane. Are you getting? Are you there?
Yes, sir.
Okay.
Yes, sir.
Yes, sir.
Okay. Just make the note. Okay. Now we'll go for the PPT. Okay. Now see here. So that is the intertubercular or transtubercular plane. Okay, at the level of L5 vertebra. Supracrestal at the level of L4, transumbilical or umbilical L3, L4. Now next plane is there. So that is the interspinous plane. So interspinous means between this plane, it extends between the two spine. Now this spine is anterior superior iliac spine. Okay. Now see here. So initially you have seen the anterior superior iliac spine, isn't it? So the anterior limit of the iliac crest, that is the anterior superior iliac spine. Okay. So this plane passes along at the level of anterior superior iliac spine anteriorly and posteriorly at the level of body of S1 vertebra. Okay. You want to see? Okay. Now see here. So this is the anterior superior iliac spine. Okay, this plane passes along the level of anterior superior iliac spine. Okay, anteriorly. So this is the spine. So interspinous plane. So they are the two spines. So anterior superior iliac spine. So anteriorly it passes at the level of anterior superior iliac spine and posteriorly at the level of body of S1 vertebra. S1 is the first sacral vertebra. This is the sacrum. So body of first sacral vertebra. Okay, so all the sacral vertebra, they are fused together to form one single bone, that is the sacrum. Okay, so this plane lies at the level of body of S1 vertebra. S1 means first sacral vertebra, body of first sacral vertebra. Okay, now in adult you will not see the individual sacral vertebra because all the 5 sacral vertebra fused together to form one single piece of bone, that is the sacrum. Similarly, the coccyx also, 4 pieces of small coccygeal vertebra fused together to form one single coccyx. Okay, in adult you will not see this. Okay, individual bone you will not see. In sacral vertebra fused together to form the sacrum, coccygeal vertebra fused together to form the one single coccyx. Okay, so this is about the interspinous plane. Okay, up to here, any confusion? So just remember the name of the plane and at which level of the body it will pass, just remember this thing. So next is the mid-axillary line. So name only suggests, see, mid-axillary line. So what is mid-axillary line? So see here. Now axilla. So anterior axillary fold, posterior fold. This is not fold. Okay. Now see here. So this anterior axillary fold. See here. Just if you raise your hand like this, you can feel one fold. Okay. So this is the axilla. This depressed region. So this is the axilla. So this is the visible part of axilla. Actually, this is only the floor of axilla is visible here now. Okay. So this fold you can see here in the side of the depression. In anteriorly you will feel one fold. Posteriorly you will feel one fold. Okay. So this fold in the anterior aspect. So this is the anterior axillary fold. Okay. Just remember now. Okay. So this is the anterior axillary fold. That is the fold. Okay. Formed by the pectoralis major muscle here. Okay. Just remember this is the anterior axillary fold. So behind you will feel the next fold. So that is the posterior axillary fold. Okay. So see, in between the two folds, so if you draw one imaginary vertical line now. So in between the two, anterior and the posterior axillary fold, in the midway between the anterior and posterior axillary fold, if you draw one vertical line, so that is the mid axillary line. Are you getting? So this is the imaginary vertical line. This is not horizontal now. Okay. So this upper, all this line plane, they are the horizontal, but this mid axillary line, they are the vertical. Okay. Imaginary vertical line or vertical plane. Okay, if that is line, so imaginary vertical line. Okay, that is drawn in the interval between the anterior axillary fold and the posterior axillary fold. Okay, so midway. So you have to take the midway between the anterior and posterior axillary fold, and you have to draw the one vertical line. So that is the mid axillary line. Are you getting? So
Yes.
interval between anterior and posterior axillary fold. Now see, here there is the mid axillary line, isn't it? So if you draw this imaginary vertical line along the midway between the anterior and posterior, that is the mid axillary line. Now there is sometimes see anterior axillary line also, posterior axillary line also. Okay. So sometimes there is, just I will write in shortcut, anterior axillary line and posterior axillary line. Now see, this anterior axillary line is, this is the again imaginary vertical line. So if you draw the imaginary vertical line from the level of anterior axillary fold, that is the anterior axillary line. If you draw the imaginary vertical line from the posterior level of posterior axillary fold, so that will be the posterior axillary line. Okay, any confusion up to here? And if you draw in between this, that is the mid axillary. Okay, so no confusion, isn't it? So anterior axillary line means at the level of anterior axillary fold. Posterior is, that is the from the level of posterior axillary fold. Okay, so no confusion. So now see, next, before going to the midline or median plane, one more is there. So that is the main line is missing here. So that is the mid clavicular line. Mid clavicular line. Okay. So mid clavicular line. Now see, you know the clavicle. Where is the clavicle? So clavicle is the bone of which girdle? So see here. So you don't know that thing also. See, while reading the segment of the upper limb,
Pectoral girdle.
yes. While reading the pectoral girdle, I have told you. No? So this is the horizontal bone. See, from here to here. Okay. So this piece of horizontal bone. Okay. So this is called the beauty bone also. Okay. So in female, now they used to expose this bone. Okay. If this bone is prominent, then they will think they are beautiful. Okay. So this is the beauty bone or collar bone. Okay. While reading the individual bone, I will tell that also. So this, you can feel this bone here. Okay. So this is subcutaneous bone along its whole length. Okay. So this is just below the skin. So subcutaneous. So this bone you can feel. So anterior end, sorry, medial end and the lateral end you can feel. Just take the midpoint between the medial and the lateral end of the clavicle. So that is the midpoint of the clavicle, isn't it? In the both side you can take. Now from the midpoint of the clavicle, just you draw the one imaginary vertical line. Okay, downward. So that will be the mid clavicular line. Are you getting? So the midpoint of the clavicle. So it is a vertical plane. Imaginary vertical plane or line. Okay. In the upper part, so it passes at the midpoint. So upper part. So this is the upper part of vertical plane, and there will be lower part also. Okay. So upper part, it lies at the midpoint. The midpoint of the clavicle. Now in the lower part, so now see here, in the lower part it passes at the level of, see here, midway between the anterior superior iliac spine and the pubic symphysis. In the lower part it passes, okay, passes midpoint between the anterior superior iliac spine and pubic symphysis. So this point is the mid-inguinal point. So directly you can write mid-inguinal point. So in the upper part, it passes along the midpoint of the clavicle, and in the lower part, it lies at the mid-inguinal point. So this mid-inguinal point means that is the midpoint between the anterior superior iliac spine and the pubic symphysis. Now see here in the diagram, I'll show you this point. So up to here, okay?
Okay, sir.
Okay, no confusion. Okay, now see here. So mid-inguinal point. Now see here, this is the pubic symphysis. Okay. So this is the anterior superior iliac spine. Just suppose you draw one line extending between the anterior superior iliac spine to the anterior superior iliac spine. So this point is the anterior superior iliac spine. So suppose you draw the one point, so one line extending between the anterior superior iliac spine to the pubic symphysis. So this is the pubic symphysis only. Okay. So this, can you see this bluish color cartilage here? So this is the joint only. Okay, pubic symphysis. Okay, so this is the anterior superior iliac spine. Now just you take the midpoint between these two. Okay, almost somewhere here, isn't it? Okay, I'll draw here midpoint also. Suppose this lies somewhere between here, isn't it? Isn't it? So this is almost midpoint. Okay. So this green dot, suppose this is the midpoint of these 2 points. So the mid-clavicular line passes along this point now. Okay. Now if you draw from here, okay. So this is the lower point, and this upper point, it lies at the midpoint of the clavicle. Are you getting? So in the upper part, midpoint of the clavicle, and in the lower part, midway between the. So this is the midway between the anterior superior iliac spine and the pubic symphysis. Or next name for this is the mid-inguinal point. Are you getting? Mid-inguinal point. Okay, now see there is one more terminology. So mid-inguinal point. Okay. So mid-inguinal point. Okay. Now there is one more terminology. Midpoint, point of inguinal. So midpoint of inguinal ligament. So there is one more terminology is there. So that is the midpoint of inguinal ligament. So now see what is the difference between these two. Now see, I will draw the inguinal ligament now here with the different color. Let me draw with the blue color. Now see, this inguinal ligament again extend between the anterior superior iliac spine. Same point. What the next point is different here. So that next different point is the pubic tubercle. Now from here to, it will extend up to here only. So this, can you see this blue color line? So this is the actually inguinal ligament. So this point is same, common. That is anterior superior iliac spine. Now for the next point, so medial point, so this is the pubic tubercle. Okay. But for this line, so this is the pubic symphysis. Okay. So this is the extension of this blue color line. So this is the inguinal ligament extending between the anterior superior iliac spine to the pubic tubercle. So this is the pubic tubercle. See, this name is given here. So, okay. So this is the pubic tubercle. Okay. This bone is the pubic tubercle. Now see, if you take the midpoint of this blue color line, so that is the inguinal ligament. Okay, it lies almost somewhere here, isn't it? Somewhere here. Okay. Okay. Just I'll draw one round structure here. So it lies almost here, isn't it? So now see, this is the midpoint of inguinal ligament, but this green, that is the mid-inguinal point. Okay, so that is the different. Okay. See the mid-inguinal point and the midpoint of the inguinal ligament. So mid-inguinal point, that is the midway between the anterior superior iliac spine and the pubic symphysis. But midpoint of inguinal ligament, that is the midway between the anterior superior iliac spine and the pubic tubercle. Okay, that is the different. Okay, one point is same, but next point is different. One is the pubic symphysis, one is the pubic tubercle. Are you getting?
Yes, sir.
So midpoint of inguinal ligament, that is the midway between the anterior superior iliac spine to the pubic tubercle. That is the midpoint of inguinal ligament. And mid-inguinal point, you know. This green is the mid-inguinal point, this blue is the midpoint of inguinal ligament. Just similar, remember the difference, okay? Now, next we'll go for the so mid-axillary line, okay, isn't it?
Okay. Yes, sir.
Yes. Now, next is the median plane. Now, median plane means, so that plane which divide the body into equal to half, isn't it? Right and left half. So, midline or median plane. You know that thing, isn't it? So, that is the median,
Yes, sir.
midline or median plane. Okay. So, this is the imaginary plane only. Okay. That passes along the level of which suture. So, there is the sagittal suture is there and that divides the body into equal right and left half. That is the median plane or midline. So midline means that line lies on the center. Okay. So these are the plane. Now see here, picture is there. From here also you can see. See here. So these are the plane. So they are the different plane. Okay. So definition if you need, just you can take the screenshot. Okay. The same thing is written here. Okay. Are you getting?
Yes, sir.
Okay, so these are the plane. Okay, just now we read this thing. So you can see one vertical plane, 6 number plane. See, so this is the mid clavicular line. Okay, so this is the midpoint of the clavicle is here, and then this is the mid inguinal point. So this is the here. Okay, so now next see here you can see all the plane here. So this is the transpyloric plane is there. Okay, so transtubercular plane, subcostal plane is there. This 2 number, this is the umbilical plane. Okay, so finally this 5 number plane, that is the transtubercular plane. Okay, or intertubercular plane, same name. Intertubercular or transtubercular. Umbilical plane or transumbilical plane. Same thing, okay? Don't get confused. And see this 1 number plane, this is the median plane or midline. Okay, so this is the plane in the that imaginary plane, so that we are going to use while reading the abdominal cavity. Okay, so for the clinical purpose we are going to use this plane, okay, to study the various structures within the abdominal cavity. Now see here, see, just forget this line now. See here, if you see the abdominal cavity, it is large cavity, isn't it? Now see, if the abdominal cavity, it is the large cavity. Now see, if you want to locate the organ, okay, without the help of this line, now see how to locate the location of this organ. Now see, this is the liver. Okay, if there is no any guideline to locate the particular location of this liver, okay, we cannot locate without the help of this guideline. Okay, now see here, all organ are the abdominal organ only. Okay, so for our easiness only, okay, for our clinical purpose or our clinical uses, so we have divided the abdominal cavity, large abdominal cavity, into different area, okay, different smaller areas, so that to study the location of various organ it will be easy. For our easiness only, we have divided the abdominal region into various smaller area with the help of this imaginary plane and line. Okay, are you getting? So now see, we can divide the abdominal region into a different area. Okay, see here, now in one picture we have divided into 4 regions. In next picture we have divided into 9 regions. Okay, most early accepted division, that is the 9 region. Okay, now we have got a next 4 region also. Now see here how to divide this abdominal cavity into different regions. Okay, what are the guideline or what are the imaginary plane, they are going to help. Okay, now see here, first we'll divide the abdominal cavity into 4 quadrants. Okay, now see here, for this we need the one horizontal line and one vertical line, or one horizontal plane and one vertical plane, isn't it? Okay, now see here, see in the left hand side, see here they have divided into the 4 region. See, for the division of 4 region we need the 2 line, one is the vertical line, one is the horizontal line, or vertical plane and horizontal plane. Now see, this is the median plane. Okay, so this median plane, you know this thing, so that passes along the axis of our body. Okay, so along the midline of the body, we'll divide the body into right and left half. That is okay. Now next is the horizontal. So this name of this horizontal plane, that is the transumbilical plane. Okay, so this is the transumbilical plane. So you know the how this transumbilical plane passes in the body, you know. So this is the imaginary horizontal plane. Okay, it passes at the level of umbilicus in anteriorly, whereas in the posteriorly it lies at the level of L3, L4. Okay, so this is the umbilical plane. Now see, with the help of these two planes, we can divide the whole abdominal cavity into 4 regions or 4 quadrants. Now see, so now I'll draw here for you. See here, so if you see the midline, so towards the left of the midline, so this is the left, isn't it? So towards the right, that is the right, isn't it? So this is the left, this is the right. With respect to midline, left and right, we can tell. Now see here, there is a horizontal plane is there, so that is the transumbilical or umbilical plane. Just give the name here. Okay, so this is the umbilical plane and this is the midline or median plane. Okay, write the name. Okay, now see here, just above this plane, so that is the upper. So just below this plane, that is the lower. Okay, now they have got a name like this. Okay, now see here. So two plane are there, one vertical plane, one horizontal. So this is the median plane. So this horizontal, that is the transumbilical or umbilical plane. Now see, so this is the one quadrant. 1, 2, 3, 4 quadrant are there. So see, this is the on the right side and the upper side. So this is the right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant. Okay, they are the 4 quadrant of the abdomen. Okay, if you are going to divide the abdomen into 4 quadrants, so we need the help of one median plane and one horizontal plane, that is the transumbilical plane. Okay, so that is the right upper quadrant, left upper quadrant, right lower quadrant, and the left lower quadrant. So they are the 4 quadrants. Now see, but the most accepted, okay, division of the abdominal cavity, that is the 9 regions. Okay, that will be widely used in the clinical practice. Okay, now while reading the different organ, we are going to tell the location of the organ with the help of this region only. So if we are going to tell the location of liver, now see here, in while reading the location of the liver, you will tell. So liver is located in the most of the part in the right hypochondriac region, some part in the epigastric, and few part in the left hypochondriac region. Okay, so this will be the location of the liver. See, liver lies in the abdominal cavity, so abdominal cavity is large only, isn't it? So now see, so abdominal cavity is this region also abdominal cavity, this region also abdominal cavity. So we will not get the particular location. Okay, for our easiness, only we have divided this into the 9 regions. So now if you say the right hypochondrium, this is the region. This region is the right hypochondrium. This is the epigastric. This is the left hypochondrium. Now how these regions are divided, I will tell. Okay, now similarly, if you want to say the location of the stomach, see, this is the outline of stomach is here. So you will tell the epigastric region and the left hypochondriac region and some part in the umbilical region. Okay, like that you will going to tell the location of the various abdominal organ with the help of this region. Now see how to divide the abdominal region into 9 regions. Okay, abdominal cavity into 9 regions. Now see, for this we need the 2 vertical plane. So we need the 2 plane. 2 vertical is there and 2 horizontal plane, or 2 horizontal plane we need. Okay, now what is the name of this plane and what is the name of this plane? What are the name of 2 vertical plane and what are the name of 2 horizontal plane? Now see here, if you see the 2 vertical plane, so they are the mid-clavicular line only. So this is the right mid-clavicular line and this is the left mid-clavicular line. Okay, so 2 vertical plane or line, they are the mid-clavicular line. On the right side, that is the right mid-clavicular line. In the left side, that is the left mid-clavicular line. Okay, median plane is somewhere here. Okay, I will draw here outline of the median plane also, so that you will not get confused here. Okay, red color I will take. Okay, midline is somewhere here. Okay, so we don't need the midline here. Okay, so midline we does not need for the division of abdominal cavity into 9 regions. We does not need the midline here. Okay, so 2 vertical plane, that is the right mid-clavicular plane and the Next is the left mid-clavicular plane. From where it passes, you know. So midpoint of the clavicle in the upper part and the mid-inguinal point in the lower part. So almost it got at the apex of the tip of the 9 costal cartilage in the midway also. Okay, that is not needed for you. Okay, just remember that passes the vertical plane that passes along the midpoint of the clavicle. So two mid-clavicular line. Now the next, see, two horizontal plane is needed. So this two horizontal plane, the upper horizontal plane, this is the transpyloric plane. Just write the name there, transpyloric plane. And the lower horizontal plane, that is the transtubercular plane. Now in your notebook, just you draw one rough diagram here. Okay. Just you draw one rough diagram of the abdominal cavity. See, suppose I will draw the abdominal cavity here. Suppose this is the, just you draw this outline here. Okay, 9 region you have to write. Don't write the name outside. Okay, just you can write inside this. Suppose this is the outline of body wall. So from here, so this is the anterior superior iliac spine up to the pubic symphysis. Okay, so from here to here, so this is the, suppose inguinal ligament is here. Okay, just you draw this outline. Okay. Now see, suppose this is the, suppose umbilicus is somewhere here. Okay. Now see here, so abdominal cavity, this is the abdominal cavity. So just above the abdominal cavity, there is the thoracic cavity, and there is the partition, that is the diaphragm is there. Just you draw the outline of the diaphragm. Okay, here. So just I will draw here postal margin first. Okay, so postal margin will go like this. Okay, from the both side it will go like this. Okay, now here is the xiphoid process is somewhere here. This is the xiphoid process. Okay, so now see here, we need the two vertical plane. Just you draw this outline, okay, in your notebook. So they are the postal margin only. Okay, diaphragm is somewhere here. Now see here, so suppose this is the abdominal cavity. Now we'll draw the two vertical plane first. So suppose this is the one vertical plane or vertical line. So suppose this is the, so this is the mid clavicular line. Okay, in the next side also there is the next mid clavicular line. Okay, are you getting? Now next, see, we need the two horizontal lines. So two horizontal lines just you draw, they are the transpyloric plane you have to draw. Almost it lies here. Okay, so one horizontal is here and the next somewhere here. Okay, it lies somewhere here. Okay, so just write the name here only. Now, so this is the left mid clavicular line. Write the name here only. Left mid clavicular line. Similarly, write for this also. Write mid clavicular line. Now, for this also you write the name here. So this is the transpyloric plane. Then write the name for this plane, that is the transtubercular plane. Transtubercular plane. Are you getting up to here? Are you getting?
Yes, sir.
Now see how many regions are there? 1, 2, 3, 4, 5, 6, 7, 8, 9. Isn't it? Now within this region only you write the name. Okay. Now for this region write the name. Within this region only you write. Okay. Inside only you write. So this is the right hypochondriac or hypochondrium. Hypochondrium. Similarly, this region. So this is the left hypochondrium. Left hypochondrium. Are you getting up to here?
Yes, sir.
Okay, draw in your copy and write only, now only. Okay, left hypochondrium. Now see in between these two, here is one region is there, isn't it? So for this region you write epigastrium. EP means above. So see, hypo means below. So hypo means below. See, this is the outline of postal cartilage, isn't it? Isn't it? Postal margin. So it lies just below this protection of this costal cartilage. So this is the below hypochondrium means the cartilage. So costal cartilage, okay, or costal margin. So just below the costal margin, hypo means below. Chondrium, that is for the cartilage. So below the costal cartilage or cartilage, that is the chondrium. So hypochondrium. So this is the left hypochondrium. So this is the epigastrium. Ep means above. So just above the stomach, that is the EP. So epigastrium. Okay. So this middle is the epigastrium. Now we'll go for this region. So this is the right side. So this region, can you see this region? So this is the right lumbar region. Right lumbar or right flank. Okay, right lumbar. So similarly, this one is the left lumbar or flank. Okay. So now in between these two regions, see this umbilical is there, isn't it? Umbilicus is there. So this is the umbilical region. So this middle region, that is the umbilical region. So write the region in the name of all. Okay. So umbilical region. So this is the umbilical region. This is the right hypochondrium or right hypochondriac region. Left hypochondrium or left hypochondriac region. Okay. Right lumbar or right lumbar region. Left lumbar or left lumbar region. Okay. So this middle is the umbilical region. So it lies at the level of umbilicus. Okay. So umbilical region. Now see there below region here. So this is one region. Okay. So this region, this is the right. So right iliac region. Iliac region. So this is the next is the left iliac region. Name is easy. Okay. Left region. Now see, this is the now next region is this. So there was the see epigastrium was there. Now this is the below. So this is the hypo means below. Hypogastrium. Okay. So this is the hypogastriac region or hypogastrium region. Okay. Hypo means below, above, below. Okay. These are the 9 abdominal regions. Just you draw this outline and write in your notebook. Okay. Okay, up to here. Now I'll go to the
Okay, sir.
slide. Okay, now see here. So this is same thing. See, this is the gastriac or gastrium. Okay, hypochondriac region or hypochondrium. Okay, left hypochondriac or chondrium. Same thing. Okay, don't get confused. Okay, so these are the region. So this is the 2 vertical plane and the 2 horizontal plane. They divide the abdominal region into 9 abdominal region. They are the 9 abdominal region. Okay, so this is the mostly accepted. Okay, division of the abdominal cavity. So while reading the location of all the organ, we are going to locate with the help of this 9 region. Okay, if you want to tell the location of spleen, so that lies in the left hypochondriac region. Spleen will be here, stomach will be here and here, liver will be here, here and here in this 3 region. Okay, if you see the kidney, so now see here. Now kidney will be somewhere here. So I will draw here outline. So your kidney will be somewhere here. So here. So it occupy all this region, isn't it? All the 4 region. So epigastrium, hypochondrium, umbilical and lumbar region. Okay. So see, if you see the suprarenal gland, see it lies at the apex of the kidney. So here you will be one suprarenal gland. Just I'll draw with the next color here. Okay. So suprarenal gland just above the upper pole of the kidney. In the upper pole, here will be the one gland. So this here will be the suprarenal gland. So here will be that will be the epigastriac region, isn't it? Now see, if you want to know the location of the stomach, that is okay. Outline is given here only. So now see, I will draw the outline of stomach. Stomach is here only. So this region, that is the stomach only. Okay, up to here. So this is the stomach. So see, what are the area occupied by the stomach? So epigastrium, hypochondrium and the umbilical region, isn't it? Now if you want to know the duodenum is here. So duodenum mostly in the umbilical region. Okay, now if you want to see the pancreas, now see here, pancreas will be here. So pancreas will be here. So it reaches up to the left hypochondriac region. So it lies in the umbilical region, epigastric region, and the left hypochondriac region. Okay. Now see the most of the region that will be occupied by the small intestine. This is the small intestine is there. Okay, it occupies almost all the region. Now for the large intestine, see here. Now I draw the outline for the large intestine with different color. Okay, green color I will take here. So see here, it will begin from here. So here will be the cecum. Cecum will be in the right iliac region. Cecum will be here, and appendix also will be here. So cecum and appendix in the right iliac region. This is the part of large intestine only. Now here see ascending colon in the right lumbar region. Now there is the bending of the large intestine. Okay, so this point, so this bending where the ascending colon terminate and the transverse colon begin. So this bending portion, that is the right colic flexor or hepatic flexor, just below the liver. So it is the hepatic flexor. This lies at the right hypochondriac. Now see, now ascending colon in the right. Now this is the transverse colon. Now see, this is the transversely running. So this transverse colon lies in the umbilical region. Okay. Now from here again the large intestine, it will bend downward. Okay, so this bending, that is the left colic flexor or splenic flexor. So because spleen is there, so this bending portion lies in the left hypochondriac region. So this is the now this is the descending colon. Now from here there is the sigmoid colon. So this now see sigmoid colon in the left iliac region also, and some part in the hypogastric region also. Now here will be the rectum and the anus. Okay. Now other structures in the hypochondriac region, you will find the urinary bladder is there. Okay. In front urinary bladder is there. Just posteriorly there is the rectum, and in between these two you will find the genital septum. The genital septum consists of the internal genitalia of male and female reproductive system. Okay. So internal, that is the, if in case of male there will be the seminal vesicle, terminal part of ductus, different ejaculatory duct, okay, and prostate gland, they will be there only. But in case of female, you will find the ovary, you will find the fallopian tube, ovary, uterus, okay, this thing. Okay, are you getting?
Yes,
okay.
sir.
So just you have to now note the what are the structures present in this 9 region. Okay, I have made the list of this organ, okay, for you. Now you can copy this organ or you can take the screenshot. Okay, now same thing, okay, which I was telling previously. Now see, so in the right hypochondriac region there was the liver was there, major portion of the liver. See, in the right hypochondrium also there will be liver. Okay, in the epigastrium also there will be liver. In the left also there will be some part of the liver. See, tip of the liver will be there, isn't it? In the diagram you have seen, isn't it? Liver was in the mostly in the right. So some part in the epi, next in the left hypochondriac region, isn't it? So that same thing I have written here. You can copy this thing. Okay. So see, right iliac region. Okay. So right iliac region means, which region is the right iliac region? See, this is the right iliac region. So see, beginning of the large intestine. So that will be the cecum will be here. Appendix will be here. Isn't it? Now the beginning of the ascending colon will be here. Okay. So this thing, and the ileum also will be here. So the same thing is written here. Okay. So this is the right iliac region. So small intestine will be almost in the all that I have already told you. So see, appendix, cecum, ascending colon, beginning part. Okay. So just remember this thing. Okay. You want to copy or what? Okay. Once I will read this thing. Now see, in the right hypochondriac region there is the liver is there, gallbladder is there, right kidney. See, kidney it occupies it lies in the meeting place, isn't it? So it lies in the all this origin. So see, right kidney will be there in the right, left will be in the left. So in the left, see here, so there will be left kidney. Okay. So right kidney and the portion of the large intestine. Okay. So portion of the large intestine, that is the hepatic flexor of colon. Colon means large intestine. Okay. Hepatic flexor or right colic flexor. I write here. So flexor, or the next name, that is the right colic flexor is the bending. So that is the portion for the portion of large intestine. Actually, this part will be there. Okay. Similarly, in the left, if you see, okay, you will also see here. But in the left, you will see the part of large intestine, that is the left colic flexor, or that is the splenic flexor. Now this is for this right hypochondriac region. Now see the epigastric region, portion of the liver is there, stomach is there, pancreas, duodenum, and adrenal gland. So adrenal gland, that is the suprarenal gland only. I have drawn, isn't it? From the apex of the each kidney, there is the suprarenal gland. Suprarenal gland means that is the adrenal gland. Next name for the adrenal gland, that is the renal suprarenal gland. Okay. So then the left hypochondriac region, see, spleen is there, large intestine. Here large intestine means that is the left colic flexor. So that left colic flexor. The next name for this, that is the splenic flexor is there. And left kidney, pancreas, stomach, and the tip of liver. So some part of liver extend up to there only. So right lumbar region, see, ascending colon, small intestine, right kidney. Okay, that we have already seen in the picture. Umbilical region, see, duodenum, kidney, small intestine, and transverse colon, isn't it? Ascending colon, bend, and transverse colon in the umbilical cord. Okay. My video is visible to you. So transverse colon, isn't it? So left lumbar region, there will be the descending colon, small intestine, and the left kidney in this region. Okay, that we have already seen in the diagram. Okay. So appendix. In the right iliac region, appendix, cecum, ascending colon, small intestine, that is the terminal part of small intestine, that is the ileum will be there. Okay. So just write the small intestine, that is okay for you. So hypogastric region. So hypogastric, see, bladder is there, portion of the sigmoid colon. See, I have already told. So small intestine and reproductive organ. See, in hypochondriac region. So male reproductive and the female reproductive organ, internal organ. Okay, that name I have already given for you. So in case of male, there is the terminal part of the ductus deferens, seminal vesicles, ejaculatory duct, prostate. Okay, in case of female, uterus is there, fallopian tube, ovary. Okay, this thing will be there. Then the left iliac region, sigmoid colon, descending colon, small intestine. That is the left iliac region. Okay. Are you there?
Yes, sir.
Okay. These are the
Yes, sir.
things you have to know about the 9 abdominal regions. So these are the structures present in that region. Now see, while reading the, for example, I will tell the kidney. Okay. Now see, if I ask you kidney, location of kidney, what you will tell? Kidney is located in which all region? So you have to tell kidney is located into the right hypochondrium. So right kidney. So this kidney occupies the hypochondrium. So means 2 kidney are there. So right kidney will occupy right, left will be left. So directly you can tell the kidney occupy the hypochondriac region, epigastric region, umbilical region, and the lumbar region. Okay, that is right for right, left for left. Okay, like that. If you, while reading the suprarenal gland, so the location of suprarenal gland, you have to tell the which region, epigastric region. Isn't it? Like that. Okay. While reading the spleen, you have to tell the that is the left hypochondriac region. While reading the stomach, you have to tell the epigastric region, left hypochondriac region, and some part in the umbilical region. Like that. While reading the appendix, that is in the right iliac fossa or right iliac region. So right iliac region is right iliac fossa. Left iliac region, left iliac fossa. Okay. Next name. Next name for the iliac region, iliac fossa. Okay, right iliac fossa or right iliac region, left iliac fossa or left iliac region. So appendix lies in the right iliac fossa or iliac region. Cecum lies there also in the right iliac fossa only. So if you see the rectum lies in the hypogastric region, like that. Okay. So maybe you are having the next class, isn't it? Division of the abdominal pelvic cavity, isn't it? Abdominal cavity and the pelvic cavity. Now see here the pelvis, that is the pelvic cavity, bony pelvis. Okay, now see here, if you see the pelvic cavity, so again we'll see the wall of pelvic cavity. Okay, then we'll see the division of the pelvic cavity here. Actually, main intention of our here, we are going to read the true pelvic cavity only. Okay, before that, how the pelvic cavity is divided into true and false pelvis, that I will tell. Then I will go directly for the true pelvic cavity and the features. Okay, now see here, first pelvic cavity we'll see. So this pelvic cavity, so this is the lower part of the abdominal pelvic cavity, isn't it? So abdominal pelvic cavity, abdominal cavity and pelvic cavity. So if you see the boundary of now pelvic cavity here, so boundary of see, if you see the boundary, see this boundary or the wall is formed by the bone and muscles. Okay, so it has got a skeletal wall, that is the bony wall. Bone is there in the wall and muscles is there. And there is also the membrane and ligament. So this forms the boundary of pelvic cavity. Now see, you can see here, so this is the pelvic cavity only. So now here it is only bone is there, isn't it? So their bones, they are contributing in the formation of the pelvic cavity. Even the muscles will contribute in formation of the pelvic cavity wall, and even the membrane and some ligament, they will contribute in formation of the bony formation of the pelvic cavity. Now we will see this thing. So see here, see in this section here, so half of the pelvic wall is shown here. So see here, this is the hip bone is there. So see the hip bone on the lateral aspect. So if you see in the full pelvic cavity here, see on the either side you will find the two hip bone, and posteriorly there is the sacrum and the coccyx. Okay, so they are the bony contribution. So the bone forming the wall of pelvic cavity. So posteriorly there is the sacrum. So this bone is the sacrum here. 5 pieces of sacral vertebra fused together to form one sacrum, and finally this tip here. So this part of the vertebral column, that is the coccyx. So the posteriorly there is the sacrum and coccyx. Okay. Now if you see in the either side, on the two lateral side, you will find the two large irregular bone. They are the hip bone. So lateral part of the pelvic wall, that is formed by the hip bone. Two hip bone, one in each side. So these two hip bone on the lateral side. Posteriorly sacrum and the coccyx. Now anteriorly here you will see the pubic symphysis. So that is the piece of cartilage is there. So anteriorly pubic symphysis. Okay, these are the bone. Okay, bony contribution in the formation of the pelvic wall. So they are the bony contribution. Now see, there is the contribution of the membrane and ligament. First we'll see the membrane and ligament, then we will see the muscles. Okay, so they are the bone forming the wall. Now there is some membrane are there, some ligaments are there. Okay, they will also contribute in formation of the wall or boundary. Now see, you can see two ligament here. Can you see here? From the sacrum to the spine and some tuberosity to the sacrum. So these two ligaments. So one is the sacrotuberous ligament from sacrum to the ischial tuberosity, sacrotuberous ligament, and from sacrum to the spine of ischium. So that this is the sacrospinous ligament. So the two ligament, they are the sacrotuberous ligament, and next is the sacrospinous. Sacrospinous and sacrotuberous, and one more is there. So this opening is there. That is the obturator foramina, and this foramina. So this is covered by the one thin membrane, that is the obturator membrane. So that is the contribution of membrane and the ligament. So sacrospinous, sacrotuberous, and the obturator membrane. Now I saw this obturator membrane, this in diagram. Okay. So you can see here. Can you see here? So this is the obturator membrane, and see two ligaments. See, one is from the tuberosity of the ischium. So tuberous. So up to the sacrum. So sacrotuberous ligament. And one ligament extending, see here. So that is the sacrospinous ligament from the sacrum to the spine of ischium. So sacrospinous, sacrotuberous. So see here, actually see. So in the hip bone, in the posterior bone, there are the two nodes. So there is the greater sciatic notch, and just below the spine there is the lesser sciatic notch. So these nodes, they are converted into foramen by help of these two ligaments. So these two ligaments, that is the sacrotuberous and the sacrospinous ligament, now this is converted into the foramen. Now this is the greater sciatic foramen, this is lesser sciatic foramen. Just remember this thing. Okay, so they are the two ligament and one membrane, that is the obturator membrane that covers the obturator foramen. So initially there was the foramen was there. Okay, so this foramen is covered by, see here, this is the foramen was there. So this foramen, it is covered by the membrane, so that is the obturator membrane. So this is the contribution of the ligament here. The bone, so this is the sacrum, coccyx, and two hip bone, one in this side, one in this side. Okay, so bone, and they are the ligaments and membrane. Now one more is there, here is the contribution of the muscle. Now see this greater sciatic foramen, see this opening is there, this should be covered up, isn't it? Wall should be there. So this greater sciatic foramen, that is filled up by one muscle, and this obturator foramen, again it is supported by the one muscle. Okay, so see there are two muscles contributing in the formation of the lateral wall. Okay, so these two muscles contributing in formation of this lateral wall. So muscular contribution in the formation of the pelvic wall. So they are the two muscles. So these two muscles, they are the obturator internus and the piriformis. Now the muscular component. So muscles forming the pelvic wall, that is the obturator internus. This obturator internus, it lies along the obturator foramen. See, you can see this is the obturator internus muscle. And one more muscle is there. This greater sciatic foramina is filled up by, most of this part of the greater sciatic foramina is filled up by one muscle, that is the piriformis. So you can see this muscle here. So see here. So this whole this opening was the greater sciatic foramina. See, most of this opening was covered up by this muscle, that is the piriformis. So they are the wall of the pelvic cavity. So bony contribution by the two hip bone on the one in either side. In the posterior side there was the sacrum and coccyx, anteriorly there is the pubic symphysis. So the membrane and the ligament contribution is by the obturator membrane, sacrotuberous ligament and the sacrospinous ligament. Then the muscular contribution is by the obturator internus and the piriformis. So that forms the your wall of the pelvic cavity. Now we'll divide the pelvic cavity now. Now the next division of pelvic cavity. Now see here. You can see here. So can you see this color part here and color part here? So this is the upper part of the pelvic cavity. So this is the one division. And next lower part, see this lower part, this color portion. So here it is uncolored here. So this uncolored, here it is colored. So this upper part, so this is the false pelvis or greater pelvis. And this lower part, that is the true pelvis or lesser pelvis. So two divisions are there in the pelvic cavity. So that is false or greater pelvis, true or lesser, minor or, okay, major or minor also we can tell. Okay, no problem for that. Major pelvis, minor pelvis. So see here. So false and the greater pelvis, the upper part of the pelvic cavity, that is the false or greater pelvis, because it is the, so this is the, it contributes in the abdominal cavity itself, this greater pelvis. Okay, so true pelvic cavity, so that is the lower part. Now see, in between the upper part of the pelvic cavity, that is the greater pelvis, and the lower part of the pelvic cavity, lesser pelvis, there is some demarcation is there. That demarcation is the pelvic brim. So just above the pelvic brim, that is the greater pelvis. This greater pelvis, that is the part of abdominal cavity only. part of so this forms the part of the abdominal cavity, that is the lower part of the abdominal cavity, and the true pelvis, that is the lesser pelvis, because we are going to read the lesser pelvis here now. Okay, division. Okay, so the pelvic brim is the division. Okay, so pelvic brim is the boundary. Pelvic brim is the boundary between the greater pelvis and the lesser pelvis. Now in this section you can see in the below picture here. So see this bleach color. So this is the wall of greater pelvis. Below this purplish color here, this is the true pelvis. So this is the true pelvic cavities here. So false pelvic cavities here. So similarly you can see here. So this green greater pelvis or the false pelvis. This purplish shaded cavity, that is the true pelvic cavity. So here is in the last picture there is the true pelvic cavity is given here. Okay. So this in between these two pelvic cavity, this boundary, that is the demarcation is there, that is the pelvic brim. Okay. So this pelvic brim we will read while reading the pelvic inlet. Okay. These are the two divisions of the pelvic cavity, greater and the lesser pelvis, or true or the false and the true pelvis. Now we'll go for the true pelvis, because we are reading the true pelvis. Okay. First you should know the division. No? So I am telling this. Now see here, true pelvis, pelvic cavity or true pelvis. Okay, we will read this under this heading. So that is the pelvic inlet, pelvic outlet, and the pelvic cavity. Okay, under these three heading we will read. Now true pelvic cavity, as you already know, this is the lower part of the pelvic cavity, just below the pelvic brim. Okay, so this portion here, this shaded portion, so this is the true pelvic cavity. You can see here, isn't it? Okay. Okay. Are you listening?
Oh, yes, sir. Okay.
Highlighted part. Okay, this cavity, that is the true pelvic cavity. Just above this part, this portion, this will be this forms the, that is the greater pelvis or false pelvis. We are not reading the greater pelvis here. So that is the lower part of the abdominal cavity only. Now here this will read. This is the true pelvic cavity under these three headings: pelvic inlet, pelvic outlet, and the pelvic cavity. Okay. So true pelvis, lesser pelvis, or minor pelvis means same thing. Okay. Now see. Now first pelvic inlet. So see here the pelvic inlet. So this is the pelvic inlet. This red color margin you can see here, isn't it? So that is the pelvic inlet. In below you see here is the black color margin is given here. Okay. So this is the pelvic inlet. Now see in this section. So in the sagittal section, see this is the posterior wall. This is the anterior wall. So anterior wall is by the pubic symphysis. Posterior is by the sacral and the coccygeal vertebra. Now see here, this is the plane of pelvic inlet. Okay, so this plane of, see in the anatomical position, actually the pelvic inlet, it does not face completely upward. Okay, actually it faces slightly forward and downward. Actually it is like this, sloping is like this. Okay, it is not straight like this. This opening is not like this straight. This opening will face like this, forward and downward. So this is the plane of pelvic inlet. Now we'll see the boundary of pelvic inlet first, because this pelvic inlet, that will demarcate the lesser pelvis below and the greater pelvis above. Okay, this margin, just above the margin is greater pelvis, the below this margin is the lesser pelvis, just above is the greater pelvis. Now see here, we'll see the margin. This pelvic inlet, that, so the pelvic brim. So generally pelvic inlet, we will consider that as a pelvic brim also. So see, now how this brim is formed. Okay, how this margin is formed. Now see here, see this is the inlet, that is the actually superior aperture of pelvis also. Okay, the next name for this, that is the superior aperture of pelvis or superior pelvic aperture. That is the next name. Okay, they have got a name: pelvic brim, superior pelvic aperture, or pelvic inlet, same thing. Now see how it is formed. See here behind you will see the sacral promontory, isn't it? Sacral promontory is behind. Then on the either side there is the linea terminalis. Then in the anteriorly there is the pubic symphysis. So that is formed, see, posterior part of the pelvic rim. That is formed by the sacral promontory. Then on the either side, means see, this side and this side. Okay, that is formed by the linea terminalis. Okay, I'll tell about the linea terminalis. Then anteriorly this. So this is the pubic symphysis. So anteriorly by the upper border or margin of pubic symphysis. Okay, so this forms the pelvic brim or pelvic inlet. Okay, so this just above this inlet, that is the first pelvis or greater pelvis. Just below this inlet, that is the true pelvis or lesser pelvis. Okay. Now see linea terminalis. See this linea terminalis. Just remember the linea terminalis. So there is the linea terminalis is formed by the contribution of this following structures. So that is the ala, sacrum, then arcuate line, then pecten pubis or pectineal line, then pubic crest. So this component contribute in the formation of the linea terminalis. So this is the ala. So this is the ala of the sacrum. From here to almost up to iliopubic eminence. This is the arcuate line. From iliopubic eminence to the pubic tubercle. That is the pecten pubis or pectineal line. From the pubic tubercle to the pubic symphysis. That is the pubic crest. Okay. So this is the linea terminalis. That is the inlet. Now see. So these are the contribution in formation of the pelvic inlet. Now if you see the direction of the pelvic inlet, means how this pelvic inlet is oriented in the body. Okay, so the axis of pelvic inlet, see, it is not like vertical, it is not horizontal. Okay, the axis or the plane of pelvic inlet is not horizontal. Okay, it is oblique. Okay, the plane of pelvic inlet is oblique. See, the obliquity, see, this plane, it faces downward and forward. See, this is facing downward and forward, and it make an angle almost 55 degree with the horizontal. So the orientation of the pelvic inlet, if you see, so it is directed, orientation of inlet. So this, if you see the orientation in, so always we will see the orientation in the anatomical position only. Okay, so the anatomical position of the pelvic inlet, see, this bony pelvis, see, will be in such a way that, see, this anterior superior iliac spine and the pubic symphysis is it lies in the same vertical plane. Okay, if you keep the bony pelvis in that position, then we can see the orientation of the pelvic inlet. Now see, the inlet, the plane will be directed, the plane of pelvic inlet is directed forward and downward. So this plane make an angle 55 degree, that is 50 to 60 degree. Okay, that is 55 degree average I will write here, degree with horizontal plane. Just remember this thing. Okay, are you getting up to here? Now if you see the difference between the pelvic inlet of male pelvis and the pelvic inlet of the female pelvis, there is some differences there. So in case of male, the pelvic inlet is like heart shape, and in female, the pelvic inlet, that is almost oval shape. So see, okay, I will draw here. Okay, rough diagram I will draw here. So the shape of the pelvic inlet, see, this inlet is this, na? So this inlet brim, okay. So this inlet will be heart shape in case of male, okay, and this will be almost oval shape in case of female. Just remember this thing. Now see here, so almost it will be so this heart shape, okay, it is almost like this. That is in male, slightly heart shape, isn't it? So this indentation, see, this is the indentation. This indentation is the due to this sacral promontory, okay. So in case of male pelvic inlet, the indentation, this depression will be more, okay. Are you getting? So this depression, this indentation in the pelvic inlet is more due, okay, due to prominent sacral promontory, okay. So it will was more forward in case of male, but in case of female, it will, this indentation will be less. So I will try to draw here. So it will be only few. So it is just a rough diagram, okay. Here I cannot draw nicely here. So this will be the pelvic inlet for the female. This outside will be female. So indentation is less, and this is almost slightly oval in shape, okay. And the pelvic inlet, that is greater for female. Okay, are you getting?
Yes, sir.
So the pelvic inlet, that is the greater. The pelvic inlet is larger in female than in male. Just write that also. Now next we will go for the pelvic outlet. So the pelvic outlet, how this pelvic outlet is formed. Now see here. Now see, this is the pelvic outlet here. Okay, see in the lower part. Okay, here is the inlet and below there will be the outlet, isn't it? So this is the pelvic outlet. Now see here. So how this outlet is formed? Now see, anteriorly there is the inferior surface of the pubic symphysis. Actually there is the arcuate ligament is there, okay. So anteriorly there is the arcuate ligament. On the either side, okay, in the anteriorly on the, see this is on the either side up to here, okay. So either side, in the anterior part there is this is the istiopubic ramus, lower border of istiopubic ramus, and on the lateral side in the posterior aspect you will find one ligament that is the extending between the tuberosity, ischial tuberosity to the sacrum. So this is the sacrotuberous ligament. So that forms the lateral boundary. So anteriorly that is the arcuate ligament in the inferior part of the pubic symphysis. On the lateral side, anteriorly there is the istiopubic ramus, posteriorly there is the sacrotuberous ligament. Then the posterior boundary that is formed by the coccyx or tip of coccyx. Okay, that is the pelvic outlet. Now see here. So pelvic outlet. So the pelvic outlet, next name is the inferior aperture of pelvis. Okay, next name is that. Now how this is formed? Anteriorly. So this is the anteriorly. So anteriorly that is formed by the arcuate ligament in the lower border of pubic symphysis. So that is the anterior. Then on the either side or lateral boundary. So this is the anterior boundary, posterior boundary, and this is the lateral. This whole thing is the lateral. So laterally see on the both sides, this side also, same thing. So there is the istiopubic ramus. This thing is the istiopubic ramus, this bone. Okay, lower border of the istiopubic ramus. And now see from ischial tuberosity up to here, so there is the ligament is there. So that is the sacrotuberous ligament. Sacrotuberous ligament. So that forms the lateral boundary. and the more posteriorly, so the posterior part, see, now posteriorly, that is the tip of coccyx. So that forms the pelvic outlet. Okay, up to here.
Yes, sir.
Okay, just copy. Okay, now see, if you see the plane of pelvic inlet, so if you see the orientation of the pelvic inlet, see this pelvic inlet, see, now I'll draw here one line here for you. Now see, this is the pelvic outlet. So this pelvic outlet is not vertical, isn't it? So it is not, so this pelvic outlet is not vertical, isn't it? See, this outlet is like that. That is directing upward but forward, isn't it? Now if you see the pelvic outlet, this outlet is also not vertical, isn't it? See, this outlet that is facing downward and backward, isn't it? So it is facing downward and backward. So the orientation of the pelvic outlet, so the pelvic outlet, it faces backward and downward. So the orientation of outlet. So it is directed downward and backward. So the plane make an angle 15 degree. Okay, so the pelvic outlet, the plane of pelvic outlet make 15-degree angle with horizontal. So see, this is not parallel to the horizontal plane, isn't it? Or it does not coincide with the horizontal plane. So see, it make an angle 15 degrees. So it is facing downward and backward. Okay, just remember this thing. Now see, one more thing in the pelvic outlet. So this pelvic outlet, so this is covered by the some diaphragm. Okay, this is covered up by the some muscle. So that forms the pelvic diaphragm. So the pelvic diaphragm guard the pelvic outlet. So it is guarded by the pelvic diaphragm. Okay, this diaphragm, so that diaphragm that forms the floor of the trunk. Okay, so here is the pelvic diaphragm is there. So here is not, this opening is not there in the body. So this is covered by the some muscles that forms the pelvic diaphragm. And this diaphragm only bears 3 opening in case of female and 2 opening in the male. Okay, so there will be 3 opening in this diaphragm. Okay, in case of female there are 3, and in case of male there is only 2. Okay, that I will tell. Now see how this pelvic diaphragm is formed. Okay, which muscles contribute in formation of the pelvic diaphragm? Now I will tell that thing. Now that is angulation. Okay, plane of pelvic outlet makes 15-degree angle with horizontal. Okay. Now see, if you see the difference of pelvic inlet in male and female, the pelvic inlet is larger in case of female than in male. Just write that. Okay. Are you getting?
Yes, sir.
See, can you see in the above picture here? See, that is the pelvic inlet picture is here. Heart shape in male and slightly oval shape in case of female, isn't it? That is the inlet. Okay. Are you getting?
Yes, sir.
Okay, now we'll go further. See, this is the pubic symphysis. This is the ischiopubic ramus. So this pubic symphysis, actually there that in the lower border of the pubic symphysis there is one ligament, that is arcuate ligament. So this arcuate ligament and this ischiopubic ramus, they are like they form one arc, isn't it? Arc-like structure. See, it is like this, isn't it? So ischiopubic ramus of one side, ischiopubic ramus of one side, and they are connected here. Okay, by the arcuate ligament. So this is the arch, isn't it? So this is known as pubic arch. Okay, so this arch, see, I will make the highlight here. So ischiopubic ramus of one side, so the ischiopubic ramus of next side, and here is the pubic symphysis, isn't it? So this here Here is the one ligament. So this is the arcuate ligament. Now can you see this arc here? So this arc. Now I'll draw the outline of arc here. So this is like arc, isn't it? This arc. So this is like arc, isn't it? So this arc is known as pubic arch. So that is the pubic arch. Okay, I'll write the name here. So this pubic arch is formed by the istiopubic ramus. The name is given here only, so I haven't written for you. So istiopubic ramus on the both side, okay, and the pubic symphysis, okay, and thus below the pubic symphysis there is the arcuate ligament. So that ligament, that is the arcuate ligament. So pubic symphysis, that is the istiopubic ramus of two sides, and in between, in the anterior aspect, just below the pubic symphysis, there is the arcuate ligament. So this forms the pubic arch. See, if you see the angle of pubic arch, this is the angle, isn't it? So this angle is greater in case of female. So just write the pubic arch. The angle of pubic arch is larger in case of female. So it is like this. So suppose this is the pubic arch of female. Just take the thumb finger and index finger and do like this. So this is the angulation of the pubic arch in case of female pelvis. But if you take these two fingers, so this is the pubic arch, angulation of pubic arch for the male. So in male it is smaller. So in male it is almost 60 to 70 degree. The angle of pubic arch, that is 60 to 70 degree in male. In case of female, it is almost 85 to 90 degree. 90 degree. Just remember this. Okay. So this will help in finding the difference between the male pelvis and the female pelvis. So in male pelvis, pubic arch is smaller. In female, the pubic arch, the angle is larger. Just remember this point. Okay. Now we'll see the pelvic diaphragm. See, this pelvic outlet is guarded by the one fibromuscular septum or muscular septum. Okay, that is the pelvic diaphragm. So this is the outlet. In outlet there are the muscles are there. So the muscles contribute in formation of the pelvic diaphragm. So only two muscles are there. Just write the name of these two muscles, that is the levator ani. Now see here, we are reading the pelvic diaphragm. Just write the name of the muscles that forms the pelvic diaphragm. That is the levator ani and the coccygeus. Now see here one muscle, see from the coccyx bone. So this is the coccygeus muscles. Remaining muscles in the anterior to the coccygeus muscle in both sides. Okay. So coccygeus in this side, coccygeus in this side. Okay. Now just in front of the coccygeus, see this muscles, that is the levator ani. Okay, so these two muscles form the pelvic diaphragm. Now this is like floor, isn't it? So that is the pelvic diaphragm. So the pelvic diaphragm separates the floor of the pelvic cavity from the perineum. Okay, are you getting? So just write the name pelvic diaphragm. It's formed by the two muscles, that is the levator ani and the coccygeus muscles. Okay, they are pair muscles in this side also and this side, right and left side. Okay, so that forms the pelvic diaphragm. Now you will see the openings in the diaphragm. Now can you see here opening here? So in the pelvic diaphragm you will see the opening. Okay, in case of female you will see the three opening, and if you see from anterior to posterior, anteriorly there is the urethral opening, then the vaginal opening in between, and the posteriorly there is the opening of the anal canal in case of female. In case of male there is no vaginal opening, so there is only urethral and the anal opening, anal canal opening. Okay, so these are the openings in the pelvic diaphragm. Now you can write, isn't it? So what are the openings? So from anterior to posterior, urethral opening, vaginal opening. This side I will write in bracket only in female. Okay, remaining all they will be in both. Then the Anal canal opening, that is the anus. Okay, anus will be in both, urethra will be in both, but vaginal opening in only in female. Okay. Are you getting? So these are the opening in the pelvic diaphragm. Now, okay up to here.
Okay, sir.
Okay. If you have any confusion, just ask. Okay. Now see, next is the pelvic cavity. Now we have seen the pelvic inlet, we have seen, isn't it? So inlet we have seen, outlet we have seen. Now there is the space, isn't it? Room is there in, isn't it? So this is room, so that is the pelvic cavity. Are you getting? So the pelvic cavity is almost like J shape. Okay, so this is the pelvic cavity. Now see, if you see the pelvic cavity, now see the wall of pelvic cavity one. So the shape of pelvic cavity is J shape. Okay, how J shape I will tell. First, before that, just see the wall of pelvic cavity. Now see, this is the anterior wall. See the posterior wall. Which wall is larger? Which wall is taller?
Posterior.
See, yes. See the anterior wall is shorter, but the posterior wall is taller. So if you see the height of anterior wall, it is almost 5 centimeter. And if you see the height of posterior wall, it is the 15 centimeter. Just write that. So the pelvic cavity has got a asymmetrical wall. The anterior wall is shorter, okay, and it is almost 5 centimeter, whereas the posterior wall is taller or larger, that is 15 centimeter. Okay. And if you see the shape of the cavity, the shape of pelvic cavity, that is J shape. Why J shape? Because see here, if you see the orientation of the pelvic cavity, see, first the pelvic cavity is directed. First the pelvic cavity is directed downward and backward. So first the pelvic cavity is directed downward and backward. Okay, are you getting? Then,
Yes, sir.
then again it curve forward. So it is again, now it is directed downward but forward. So initially in the upper part it is directed downward and backward, and the lower part it is directed downward and forward. Okay, so it will not be straight like this. Okay, so it is slightly. Okay, so there will be
Yes, sir.
two curvature in the pelvic cavity. So first directed downward and backward, then downward and forward. So due to that, the pelvic cavity is J shape. So that is the plane of pelvic cavity. Okay. So due to that only this is J shape. I will write for you here. So first the pelvic cavity is directed downward and go backward, then it is directed downward and forward. And the difference in the height of the wall of the pelvic cavity, you know, that is anteriorly 5 centimeter tall, posteriorly that is 15 centimeter tall. Now if you see the difference in the pelvic cavity, okay, so in the case of female, the pelvic cavity is wider and larger, the room is more there, okay, but in case of female, sorry, in case of male, the cavity is smaller and smaller, okay, the cavity is larger in case of female, just remember that, okay.
Yes, sir.
Now see, if you see the content of the pelvic cavity, then what will be there in the pelvic cavity? Okay, the content. Now see, so I will tell for the male and female, okay, because see in male different organ will be there, in female different organ will be there, isn't it? So see, the common organ in case of male and female. Now see here, just I will draw one shadow here for you. Now see, if you see from anterior to posterior, so the organ is like this. Now see here, the anteriorly, so here will be the urinary bladder. Just rough diagram here, okay? So there is the anteriorly, there is the urinary bladder. And the posteriorly you will find the rectum and the anus. Rectum and the anus posteriorly. Later I will take the next. Here, somewhere here, so urinary bladder will be there. In case of male and female both. First I will tell the common organ, okay? And posteriorly, there will be the sigmoid colon, rectum, and the anal canal. So this follow the curvature of the spine. So suppose this is the sigmoid colon, rectum, and the anal canal. Okay, that will be in both male and female. But the structures present in between them will be different. In female, different organ will be there. In male, different organ will be there. Now, in between these two structures, the area that is covered by the areolar tissue, in which there is the reproductive, internal reproductive organ of the male and the female. Okay, will be there. So that is the genital septum. Now see here. So what are the content? So anteriorly, urinary bladder. Then posteriorly, there is the sigmoid colon.
Excuse me, sir. Another sir is waiting, sir.
Okay, then we'll continue in next class. Okay.
Okay, sir. Thank you.
See, we are reading the pelvic cavity, isn't it? So, lesser pelvis or true pelvis we are reading. Okay, so lesser pelvis we have read under the different heading: pelvic inlet, pelvic outlet, and the pelvic cavity. So you have already seen that the pelvic cavity, that is J shape. Okay, so this J shape is due to the upper part of the pelvic cavity is directed downward and backward, whereas the lower part of the pelvic cavity that is directed downward and forward, giving the J shape appearance to the pelvic cavity. This whole thing is the pelvic cavity only. And the pelvic cavity that is larger in case of female. Okay, if you compare with the pelvic cavity of male, it will be larger in case of female. So content we are reading. Okay, so the content, see, the pelvic cavity consists of most of the internal organ of reproductive system in case of male and female. Okay, then also other structures of like lower part of the alimentary canal and the part of urinary system also are there. Okay, now we'll write the name of this organ which are present within the pelvic cavity. Okay, so anteriorly you will see the urinary bladder. Okay, here you will see the urinary bladder. Okay, in the anterior part of the pelvic cavity. Then in the posterior most part you will see the sigmoid colon. Okay, then sigmoid colon, then it will continue as the rectum. Okay, then the beginning of anal canal you will see in the posterior part. Okay, so suppose this is the outline. Now in between the rectum and the urinary bladder, so this portion, that is the genital septum only. So this genital septum, it consists of the areolar tissue, okay, within which there is the male and the female reproductive organ. In case of male, there will be the male reproductive organ, that is the internal organs, and in case of female, internal female reproductive organ are there. Okay, so that is genital septum in between this urinary bladder and the rectum. Okay, so in the middle you will see the reproductive organ. Now see what are the organ you will see in this genital septum in case of male and in case of female. See here, so you will see the first urinary bladder, that is in the anterior part of pelvic cavity. So sigmoid colon, then rectum and anal canal posteriorly. Now in between, so in the midway or the middle, So middle part, it consists of the genital septum. So this genital septum means that is the areolar tissue in which the internal genitalia or internal reproductive organ of male and female are packed. Okay, in this part. Now see what are the male reproductive organ you will see in this part. So in case of male, the genital septum is comparatively thin. Okay, so in this genital septum, in case of male, you will find the prostate. Okay, so for seminal vesicle, ejaculatory duct, terminal part of ductus different, part of ductus difference. Okay, then even you will see the prostate and the here you will see the prostate here. Okay, just below the urinary bladder, around the neck of urinary bladder, you will see the prostate. Okay, this prostate you can write here also. Urinary bladder and prostate here also you can write, here also no problem. So prostate you will see in case of male. So now in case of female, the genital septum is comparatively thick. So in case of female, in that genital septum, you will see the uterus, fallopian tube, ovary, then the ligament of ovary. Okay, so even you will see the broad ligament. So within the broad ligament there is round ligament. Okay, so various things are there. So this thing you will see here. So uterus, fallopian tube, okay, ovary, ligament of the ovary, broad ligament. This structure you will see here. Okay, in the genital septum of female. In case of male, you will see this structure. Okay, and urinary bladder, sigmoid colon, rectum, anal canal. You will be seeing this thing in case of both. Okay, now other structure you will see there, that is the terminal part of ureter. So ureter, that is the from the kidney. So the kidney will form the urine, and that urine is carried by the ureter to the urinary bladder. So the terminal part of the ureter also you will see in case of both. So this highlighted part you will see in case of both. Okay, so this is the structure you will see in case of only male, and this below structures that is you will see in case of female. Okay, so this consists of the genital septum. So genital septum in case of male, it is comparatively thin. So space is thin in between the rectum and anal canal. The space will be very thin, very less space is there in case of male. But in case of female, the space is comparatively larger. So that consists of the uterus, fallopian tube, ovary, ligament of ovary, broad ligament, etc. Okay, so these are the major content of the pelvic cavity. Okay, so this middle portion, that is the genital septum only. Okay, then see, so now see here, so the plane of pelvic inlet, you know, isn't it? So that is the anterior posterior diameter of the pelvic inlet. Okay, just I'll write here, just AP means anterior posterior. Okay, anterior posterior diameter of pelvic inlet. So this diameter is almost approximately 11 centimeter. Okay, 11 centimeter, just write that. Okay, so 11 centimeter, and this diameter is also known as true conjugate diameter. Okay, so this diameter is also known as true conjugate diameter. So See, this is the true conjugate diameter, that is the anterior posterior diameter of the pelvic inlet. So that we actually see this anterior posterior diameter, we are going to measure from the upper or anterior end of the sacral promontory or the upper border of the body of first sacral vertebra to the upper body of pubic symphysis. So this distance, okay, this distance, that is the anterior posterior diameter, that is the true conjugate diameter, that is approximately 11 centimeter. Okay, just you write approximately here, approximately 11 centimeter. Now next, see here, you will see the diameter in the lower part, that is the diameter in the plane of pelvic outlet. So that is the anterior posterior diameter of pelvic outlet. Okay, that is almost, so it may be vary, okay, 9.5 to 9.5 centimeter to 11.5 centimeter. Why there? That is 11.5 cm. See why they will vary? Because see this tip of coccyx, so it is mobile only. It will move. So this that portion you can see, this can move. Okay, so it is freely moving. So the diameter increases. Okay, in case of female, so during the childbirth, okay, so this diameter will increase because this coccyx can be moved backward and forward. Okay, so the diameter may be 1.5 to 9.5 to 11.5 centimeter. Okay, just remember that that is the anterior posterior diameter of pelvic outlet, because the tip of coccyx is freely mobile here. Okay, so this joint, that is the sacrococcygeal joint. So the sacrococcygeal joint, that is mobile. Okay, so this during the childbirth, this coccyx will move along the sacrococcygeal joint to provide the passage for the fetus. Okay, while delivery of the baby. Okay, now next diameter, that is the diagonal conjugate. So this diagonal conjugate, see here. So the diagonal conjugate diameter, that is the diameter from, see, that is the length, okay, or diameter. So measuring from the sacral promontory to the lower border of the pubic symphysis. Okay, if you measure this distance, that will be almost, okay, it will be 1.5 centimeter larger than the true conjugate diameter. Okay, this diagonal conjugate diameter, it will be 1.5 centimeter greater than true conjugate diameter. So this is the diagonal conjugate. So it will be 1.5 centimeter greater than this true conjugate. Okay, just add 1.5 centimeter to the true conjugate diameter. That will be the diagonal. Now see this diameter of the pelvic outlet. So that is measured from the lower border of the pubic symphysis to the tip of coccyx, that you know already. So just remember this measurement. Okay. So true conjugate, that is the anterior posterior diameter of the pelvic inlet. Then diagonal conjugate, that is 1.5 centimeter greater than the true conjugate. Okay. Then the diameter of pelvic outlet, that is the anterior posterior diameter, that is measured from the lower tip of the coccyx to the lower border of the pubic symphysis. Okay, just remember. So this diameter may vary because the mobile coccyx. Okay. Now we'll go forward. See other body cavities. So these are the body cavity present within the skull, okay, or head. Now see, you will see the orbital cavity. So just remember the name and the content of these cavities, okay. So the cavities, other body cavities, generally the cavities present in your skull, okay. So skull, okay. So orbital cavity. So the two orbital cavity on the side of the nose. So see, this is the nose is here. So here in the side of the nose there is the two orbital cavity. See this yellow color here, you can see here. So this is the pyramidal shape. Okay, so that is the orbital cavity. So generally this orbital cavity provides the space for the eyeball and its supporting structure. Okay, so that is the orbital cavity. Two orbital cavity at the side of the nose. So next is the nasal cavity. So the two nasal cavity you can see here, the schematic representation of the nasal cavity here. Okay, so this is the nasal cavity. Okay, we'll read the nasal cavity in separate heading. Just remember the nasal cavity. So you can see the nasal cavity. Okay, from 1 and 2. Two nasal cavity are there. So next cavity, that is the oral cavity. So oral cavity, you know this thing. So this is the oral cavity. Okay, that is the cavity of mouth. Okay, so major cavity only I am writing here. So cavity of ear. Okay. Next is the cavity of ear. Okay. So here also it has got a cavity. So okay. So here you can see the inlet of the cavity, that is the external auditory tube is there. So here you can see. So this green is said here. So external auditory tube is here. Then the middle ear cavity. Generally here we are considering the middle ear cavity. While reading the ear it will come. So middle ear cavity. So these two are the middle ear cavity. Okay. Just remember this thing. So the major cavity of the skull you already know, that is the cranial cavity we have already read. Okay, here just they are the minor cavities in the skull. Okay, so that I'll write here cranial cavity also. So that is the major body cavity. Okay, that is the dorsal body cavity. Cavity of skull. Okay, that you have already read in during the dorsal body cavities. So remaining this space, see this orange color space, that is the cranial cavity. Here you can see this whole box, that is the cranial cavity. This cranial cavity is also known as brain box. Okay. So this is about the body cavities. Okay. Now the body cavity is over. Okay.
Okay, sir.